So, folks, the holidays are behind us. We still got a lot of winter ahead of us. My God. But let's be honest, it is a tough time of the year to start new resolutions. I started off this year with no absolutely like abusing cookies in the office, and it fell apart yesterday in a big way.
Anyway, keep going. It's just
I just had too many cookies yesterday. I had to get them out of the office. But the point is, a lot of folks are taking breaks from drinking, dry January. And if that's you, good on you. That's not easy, especially when it's dark at 4:30 in the afternoon. Everything feels like a lot, as it were. Making healthy changes takes effort, and having the right support actually matters. That's where our friends at Sunset Lake Seder come in. Right now, they're offering 25% off all of their gummies when you use the code JAN26, as in January 26, 2026. JAN26. That's JAN26. No spaces. The gummies are great. They're great for helping you to go to sleep. They have some sleep time gummies. They've got some gummies with some THC, 1 milligram, which is, just enough to make you feel like you're having fun, but not so much that you're in the corner drooling or anything like that.
right.
They also have just some straight Zebedee gummies that are fantastic as well. And I have found that, one of those 1 milligram THCs, I don't need to drink. I'm done. And frankly, don't need the calories from beer or anything like that. So if you're winding down after work, you're skipping that bedtime nightcap, or just trying to take the edge off without alcohol, Zebedee gummies can be the easy alcohol-free way to relax. Head over to sunsetlakesebedee.com. Use the code JAN26. That's JAN26. No spaces, to save 25% on their full lineup of gummies to support your New Year wellness goals and dry January aspirations. Sale ends January 7th at 11:59 p.m. Eastern. See their site for full terms and conditions. That means you got about 24 hours. Get on it. And now time for the show.
The Majority Report with Sam Seder.
The destiny of America is always safer in the hands of the people than in the conference rooms of any elite.
Sam Seder.
They are unanimous in their hate for me, and I welcome their hatred.
We must guard against the acquisition of unwarranted influence, whether sought or unsought, by the military-industrial complex.
The Majority Report with Sam Seder.
If I get the feeling you've been cheated.
It is Tuesday, January 6th, 2026. My name is Sam Seder. This is the 5-time award-winning Majority Report. We are broadcasting live steps from the industrially ravaged Gowanus Canal in the heartland of America, downtown Brooklyn, USA. On the program today, Dr. Kristen Lyerly, OBGYN and chair of the Board of Committee to Protect Healthcare. On the CDC assault on vaccines, this, as the flu hits its highest levels in 25 years across the country. Meanwhile, Trump floats the idea of a taxpayer bailout for oil firms developing Venezuelan oil. Yep. U.S. allies warn Trump hands off Greenland. Health Department to freeze $10 billion in funding to 5 Democratic states. No point in having a budget if they're not distributing funds that have been allocated. Republican House member Doug LaMalfa suddenly dies. California's 1st district. Further shrinking the Republicans' advantage in the House. Meanwhile, only 1 in 3 Americans support Maduro's ouster. Trump regime sends 2,000 federal goons to Minneapolis. 2,000. They have 10,000 Marines off the coast of Venezuela, ostensibly to control that country. DOJ admits it still has millions of unreleased Epstein files. And the Department of Homeland Security has plans for massive FEMA cuts. Corporation for Public Broadcasting shuts down because it has no more funds. Graham Plattner announces Q4 fundraising numbers, $5 million. Average donation somewhere in the high 20s, $28 or something like that. Meanwhile, happy January 6th. Donald Trump pardoned all of those rioters.
No harm, no foul.
Some of them Nazis. I mean, just based upon their Heil Hitlers and
All of
other
them
sundries.
patriots, though. So
All
stop being
patriots.
such a killjoy.
Other P words as well.
All this and more on today's Majority Report. Welcome, ladies and gentlemen. It is
Newsday Tuesday.
Newsday Tuesday, the first Newsday Tuesday of 2026.
Yes, sir.
So things are getting pretty exciting around here. I also want to just note.
First day, big problems here.
Yes.
Who is that? Who is that?
Oh, you know who it is.
No, I don't.
Oh, yes, you do.
Who?
Dopical.
Oh, yes, 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 yes. The guy who recircumcised himself when converting to Judaism.
Primetime Dokapil.
Well, I mean, to be fair, I do that whenever the Patriots win the Super Bowl. So,
7 times?
yeah. Hey, had a lot to work with.
Maybe 6, I can't remember.
Anyways, I wanted to note that it's been 2 days and I've done 2026 correctly every time.
I know. I didn't
Like,
even
I
remind
know,
you today.
Nope.
Which you resented yesterday.
Listen, I'm on top of this. On day 1, I can get it. It's going to be like day 4 and 5. It's going to be a problem.
This is going to be May and you're going to be doing it.
Yeah, exactly.
Reverting to 2025.
Without a doubt. No, it's just, I'm sunsetting. So that's,
If you're going to time travel, can you go forward?
yeah, exactly.
I know. I know. What's the stuff that Michael Jackson was on that just made him sleep for like 2 weeks at a time? I feel like I need some of that.
Oh, no, that's propanol.
Yeah.
Just kidding. I'm joking.
That actually, I mean, now that you mention it, it depends. I mean, I've told this story a couple of times, but when you get a colonoscopy, on the West Coast, they use propanol a lot more than they do on the East Coast in terms of using the propanol, and it has to do with like insurance coverage. I'm not going to get deep into that, but I had it once, and I'll tell you, like for 3 days afterwards, you feel great.
Yeah.
I mean,
Well,
I understand.
Not advocating for anyone to do it.
No,
Yes.
it's not
Good
like
luck trying to.
it's not like you can pick some up at the bodega. But all right, let's get into this. It is becoming increasingly clear that there is no plan for Venezuela, or I should say that Donald Trump does not actually have a plan for Venezuela. It seems like there's a bunch of other people who have plans for Venezuela, and they seem to be not necessarily all on the same page. There's been reporting, and we talked about at least testimony that was delivered in 2019, and then ostensibly some reporting from what's been on, videos that have been on Russian Telegram channels, that Putin had encouraged Trump to adopt a modern day Monroe Doctrine, or the Donroe Doctrine, as Trump has been talking about. And the idea being that, look, we're in a multipolar world, and you don't have to mess around with China. You don't have to mess around with Russia. You just essentially create Fortress America. You control and dominate the Western Hemisphere. and you'll have all the resources you need. You'll have shorter supply lines. All of that sounds all well and good.
And let me do what I would like with Ukraine. It is my territory. You know, why don't we just kind of put all of this aside? We're all in this together, right? We'll carve up the world.
It's like a mafia. It's basically like a mafia
it's
deal.
territory.
You know, I've been rewatching a little bit of The Wire. I mean, it's that type of thing. Now, the biggest problem for the execution of that, however, is that this is not 1935. This is not 1965. This is not 1895. These countries no longer are so easily dominated by the U.S. in the way that it would have been 50 or 60 years ago, because there's so many weapons there. And so with 10,000 Marines off the coast of Venezuela, the United States is not in a position to invade and take over Venezuela. And it is unclear, it became clear, I think, to Trump, or at least Trump was, there was a lot of neocons who were like, oh, we're going to put in Maria Corina Machado and get rid of the Chavistas, the Hugo
Marxists.
Chavez, Marxist folks. And then, she's going to open up. I mean, she literally said 6 months ago, I'm going to give all the oil back to the Americans, essentially. And so I think there were people in the administration. Lindsey Graham reportedly was very encouraging on this coup and kidnapping of Maduro. But I think he thought that Maria Corina Machado would get the nod from Trump, and his neocon fantasies would be carried out. But Trump seems to have basically just stopped, in part because some people suggest that Trump mentioned this today, apparently, or yesterday, that he was going after Maduro because Maduro was mocking him by doing
his dance. And if you can believe that, then you can believe that he would be so spiteful towards Maria Corina Machado that he wouldn't impose her as the leader of Venezuela, because the practical realities don't stop these people. I mean, they're behaving in a very unhinged manner altogether. We read in the Paquete that the CIA briefed the administration and said that she wouldn't have the infrastructure to take over the government, and that's true. She has been since the early 2000s in the sphere of right-wing neocons, NGOs here in the West getting these awards, right? I mean, there's a cultural memory in Venezuela where people understand that these are the Yankees trying to steal our resources and imposing their preferred candidate, like they did with Guaido and like they've done across Latin America. And so this hadn't stopped them before. She'd been enormously explicit, but the point is the arrogance of the neocons is paramount here. So why didn't they try?
Well, I mean, I think they tried.
Now we know the answer. It could just be Trump's pettiness.
Well, and we should also say too, and later in the program, we will dig into sort of the theory that perhaps this was just one of the biggest winners was this billionaire hedge fund guy, Paul Singer, who essentially bought the U.S. Portion of Chevron, which was the Venezuelan oil company, and bought it for 50 cents, 30 cents on the dollar. And this is a way to make him,
Citco, right?
Citco, excuse me,
yeah.
very, very wealthy. And but before we get there, here we have Sean Hannity, and Sean Hannity has always been essentially a Republican operative. He had a very good relationship with Donald Trump because he kisses people's asses, and he was basically a main advisor to Trump in his first term, probably still the case. But everybody's afraid of Trump. They want to convince him the way that where Trump comes to it himself, and it's quite clear that all these neocons, I'm talking like Lindsey Graham and, whoever, other neocons who are sort of interested in the notion of getting rid of the Marxists in this area and maintaining our hegemony insofar as we have an open policy for U.S. corporations there, got into Hannity's ear and we're like, dude, you're the only one who can save this now. We need Maria Corina Machado to get the nod from Trump. You got to do your magic, and watch how like desperate Hannity is in there to like.
Not the only desperate person in this clip. I mean, this is humiliating on so many different levels.
Watch this.
And it's not very usual that people will dedicate the Nobel Peace Prize to the leader of a different country and say publicly, he deserves this more than I do. But you did that.
Let me be very clear. As soon as I learned that we had been awarded the Nobel Peace Prize, I dedicated to President Trump because I believed at that point that he deserved it. And a lot of people, most people said it was impossible to achieve what he has just done on Saturday, January 3rd. So if I believed he deserved it on October, imagine now. I think he has proven to the world what he means. I mean, January 3rd will go down in history as the day justice defeated a tyranny. It's a milestone, and it's not only huge for the Venezuelan people and our future, I think it's a huge step for humanity, for freedom and human dignity.
Have you spoken with President Trump since then?
I spoke with President Trump on October 10th, the same day the prize was announced. Not since then, but I do want to say today.
That's.
So not since then.
Have I spoken to him? Yes. I mean, 2 or 3 months ago, but.
I haven't spoken to him since I got the prize that was rightfully should have gone to him.
But how did that conversation go?
Here's the coup de grace, though, ladies and gentlemen. Just go back a little bit. Let's see if she's ready.
Spoke
President Trump since then.
I spoke with President Trump on October 10th, the same day the prize was announced. Not since then, but I do want to say today, on behalf of the Venezuelan people, how grateful we are for his courageous vision, historical actions he has taken against this narco-terrorist regime to start dismantling this structure and bringing Maduro to justice, which means that 30 million Venezuelans are now closer to freedom, but also that the United States of America is a safer country nowadays.
Right. Did you at any point offer to give him the Nobel Peace Prize? Did that actually happen? I had read that somewhere. I wasn't sure if it was true.
Well, it hasn't happened yet, but I certainly would love to be able to personally tell him that we believe the Venezuelan people, because this is a prize of the Venezuelan people, certainly want to give it to him and share it with him. What he has done, as I said, is historic.
Oh my God. That is
words. Where's my gold?
You know. The problem is, she's like maybe a 5, and I don't know. She's just like out of my age range.
Yes, well, there you go.
You know, so
she's aged out.
She's aged out.
Like
Maybe if it was the 80s.
If maybe I had gotten it before, but you know, when you have to actually kidnap a leader of another country to get your peace prize, it doesn't feel as good. I'm sorry, I just don't want to have to. Makes it feel like I'm being too
The problem is
thirsty.
she
So.
lacks what Zoran had in the Oval Office, which is like an aura of being a winner.
Yeah.
Right.
Sorry.
Right.
She should have given it to him October 10th. You had your opportunity. More on Venezuela later in the program, of course. And in a moment, we'll be talking to Dr. Kristen Lyerly, an OBGYN and chair of the board of committee for to protect health care on the CDC's assault on vaccines, as announced, I guess this morning, maybe yesterday afternoon, I should say. But finding a doctor, speaking of which, you actually feels like finding a diamond in the rough. Sure, you want to find someone who's in network, someone who's nearby with open time slots. But let's be honest, that's just a start. You also deserve someone who really listens, who makes you feel comfortable, explains things clearly, and still gives you a lollipop, even though you're a full-grown adult, if you want one. Your diamond in the rough doctor exists, and finding them is easy on ZocDoc. ZocDoc is a free app and website that helps you find and book high-quality in-network doctors so you can find someone you love. We're talking about booking in-network appointments with more than 150,000 providers across all 50 states. Doesn't matter whether you're looking for dermatology, doesn't matter whether you're looking for a dentist, for a primary care, for eye care, or for one of the other 200 plus specialities that are offered on ZocDoc. You can easily search by a specialty. You can search by symptom. You could search, there's all sorts of different filters. Build the care team that's right for you. You want to look, you want to see your doctor in person. You want somebody who's in network. Do you want a video visit instead? All of that you can do through ZocDoc. When you're ready, you can see their real-time availability and click to book that instantly. In other words, you don't have to call up, ask the receptionist, what days do you have? Well, what day do you want to come in? Well, what days do you have? Like, I can do it on Tuesdays and Thursdays after. You don't have to do any of that. It's all on the screen. You see what appointments are open. You book it, click, boom, you're booked. And often with ZocDoc, you can sometimes see your doctor within 24 hours. Typically under 72 hours. And I can tell you that for me, I was traveling, I think this is actually a couple of years ago now, and needed a dentist. ZocDoc was there for me. I had a little dental emergency. But both Emma and Matt have found doctors through this. Yeah. ZocDoc, I want to thank ZocDoc for sponsoring today's episode. Stop putting off these doctor's appointments and go to ZocDoc.com/majority to find and instantly book a doctor you love today. That's ZocDoc.com/majority. ZocDoc, ZocDoc.com/majority. Thanks to ZocDoc for sponsoring this message. Also sponsoring the program today, a product I use literally every day, actually multiple times a day, because we use Blue Land products in the bathroom here, hand soap, toilet bowl cleaner. We use it in the our office pantry area with the dishwashing. Yes. I use it all over my house with multiple cleaners. Why? Because I was tired of, well, a couple of things. One, I read that we ingest a huge amount of microplastic, whether it's from those little plastic pods that you put into the dishwasher, or just all the plastic that we use. Something like over half of the plastic that that exists in the world now has been produced in the past 10 years. We have a real problem. On top of that, I got tired of lugging massive jugs home from the supermarket full of laundry detergent or dishwasher liquid. I no longer do that because I use Blue Land across all the cleaning products in my home. It is certified by Cradle to Cradle. Blue Land products meet the highest standards of clean. They're effective yet gentle on people and the planet. They have cleaning sprays, like I say, toilet bowl cleaner, dishwasher, and laundry detergent tablets. Blue Land's 100% microplastic-free, EPA Safer Choice certified formulas are safe to use around my kids, my kitties, my cat. I have one cat, and my girlfriend's puppies, my plants. I cannot tell you how much I love Blue Land. And it's also less expensive. I mean, they don't push that in the copy here, but you can buy refills really reasonably, and they're little tablets, so you don't you're not using your whole closet to have backup on this. I cannot tell you how impressed I am by this product. Blue Land's on a mission to make it easy for everyone to make sustainable choices. We believe that hardworking, clean products can be the norm, not the exception, so that you can do better for your family and the planet at the same time. Blue Land products independently tested to perform alongside major brands, and the formulas are free from dyes, parabens, and harsh chemicals. Blue Land is a certified B Corporation, certified cruelty-free by Leaping Bunny. Their formulas are EPA Safer Choice certified, and many have received gold material health certificate from Cradle to Cradle. Blue Land is trusted in over 1 million homes, including mine and my office. Blue Land has a special offer for listeners right now. Get 15% off your first order by going to blueland.com/majority. You don't want to miss this. Blueland.com/majority, 15% off. That's blueland.com/majority. Get 15% off. Do yourself a favor, buy a bunch of stuff and take advantage of that 15% because you will be happy you did. Quick break. When we come back, Dr. Kristen Lyerly, OBGYN, chair of the Board of Committee to Protect Healthcare, on the latest assault on vaccinations by our CDC. We are back. Sam Seder, Emma Vigeland on the Majority Report. Joining us now, Dr. Kristen Lyerly, an OBGYN and chair of the board of the Committee to Protect Healthcare. Kristen, thanks so much for joining us. Two big stories out today, not exactly unrelated. One being that we are suffering one of the worst flu seasons in about 25 years, at least in terms of people who have contracted the flu and coming in with symptoms, and announcement from Health and Human Services that they are narrowing the guidance on childhood vaccinations. Walk us through what both those announcements mean. I mean, I think everybody knows what it means when it's a bad flu year.
Yeah, well, I think we better get used to bad name your disease years. Right now, it's the flu because this is respiratory season. We always see respiratory viruses rising at this point. But what we're also seeing is a rise in measles, a rise in whooping cough, a rise in a number of other vaccine preventable diseases because of this administration, because of the political messaging that they are putting out into the universe and that people who follow them are listening to. I mean, I'm seeing in my own patients, and I'm an obstetrician gynecologist. I take care of pregnant people, but in my own patients, we vaccinate against whooping cough toward the end of pregnancy, and we vaccinate for the baby because a newborn with whooping cough, first of all, we can't vaccinate a newborn against whooping cough, but it's really hard to treat and it's painful to watch and babies really suffer. But I'm finding a lot of moms are not wanting to vaccinate, or they're asking a lot of questions because they don't trust vaccines the way that they used to. And now with these new recommendations that were made with very little thought, that were very clearly politically motivated, they've reduced the number of recommended childhood vaccines from 17 to 11. And they've spaced them out in a way where they won't be protective for a lot of these young children, which ultimately means that we're going to see a lot more of these preventable diseases.
Do we even know what the process was to make this change?
Magic wand.
What's that?
Magic wand, I think.
Well, but I mean, honestly, because in the past, there is at the very least, there is transparency in terms of how, we have an advisory committee that issues, suggestions. Here, it's just sort of like Kennedy met with whomever or had these ideas and just rolled it out, essentially.
I don't mean to be glib. I'm a physician. I went to medical school for 4 years. I did 4 years of residency training. Every year I have to do continuing education to make sure that I know what's going on so I can take care of my patients. What they used to do is they brought together experts from all over the country who understood the research, who put their heads together and made recommendations about what do we need here in the United States? What is the best thing for our population of people at certain ages in their development? And that was how these decisions were made. They were thoughtful, they were protracted, they had footnotes, they were very detailed, but what happened yesterday was literally just, this is what we're doing. There were no resources, or there was no data, there was no evidence. It was just this change, and a change that they're selling to the people as reflecting what's happening in other countries. But other countries are not the United States of America. Other countries have universal health care. Other countries have parental leave. We don't have any of those supports here. And all of those things have to be factored into how we take care of our people.
Okay, let me ask you about that specifically, because we should also say that it turns out the fact is that we are actually now below the number of recommendations that we have in terms of vaccination, actually below a lot of the European countries with this new announcement. But explain how the difference of having universal health care, how that impacts this. Because it's true, we don't have the same health care, we don't have the same level of support. But I'm thinking like specifically, like I'm looking at the flu shot, for instance. The U.S. Will no longer recommend annual flu shots for children. They'll suggest to parents make the decision in consultation with medical professionals. But because of the cost of healthcare, and because a lot of people don't have doctors, you don't have the opportunity to consult with a doctor. You don't have a doctor who's saying like, hey, you're in here for your annual physical. Make sure you get the kids a flu shot. You are severing the relationship between this medical advice and patients.
You're spot on, Sam. They just took Medicaid away from a large swath of the population, including children. They just cut ACA premium assistance. So millions of Americans are going to go without health care. And then they turn around and say, you have to talk to your doctor in order to get these preventive measures to protect your health care. It doesn't work that way. And they're also cherry picking this data. The United States is not Denmark. The United States is much, much larger, much more diverse. Denmark is about the size of Minnesota. So, think about it. It doesn't work that way. And by the way, what is up with our obsession, with the Trump regime's obsession with Denmark? It's the vaccines. It's Greenland. What is it going to be next? Confiscating Legos? I don't understand why they are so concerned about Denmark. This is the United States. We need to tailor our health advice, our health care for the people who live here.
Well, the HPV vaccine being a part of this as well takes me back to when I was the age when I got the HPV vaccine. And I remember some of my friends having it being controversial with their parents. And this is like a fight, basically, that goes all the way, years, and the Republicans have been waging on it. So it's just fascinating to see, you talk about the lack of coherence here. This isn't just new with the RFK Jr. Movement. The Republicans and the conservatives have been waging war on science and these kinds of vaccinations for a while.
They sure have. As an OBGYN doctor who was training during the time that they rolled out the HPV vaccine, I remember that so clearly. Because to me and my colleagues and my patients, this is a cancer-preventing vaccine. But politicians were saying, this is a vaccine that we're giving to 12-year-old girls that will make them promiscuous.
That was the big argument.
Yeah.
The big argument was this is going to make them more likely to have sex because now they feel like they have a license to have sex without getting HPV, which I can tell you that even, at the time this was happening, someone in probably in his 30s at that time, I had never even heard of HPV in that way. So the idea that I had been vaccinated or not vaccinated against it, but it's funny how it went from a religious sort of like, because that was very big during the aughts when this was happening. The idea of you know, having chastity balls and getting rid of sex ed in schools was a very big push, and it's sort of like mutated. It's almost as if like sort of that fundamentalist anti-sex ed energy sort of went into the sort of the Maha movement in some way and mutated, and some of that vaccine hesitancy was adopted. But I want to go through some of the specifics here. When Emma mentioned HPV, we talked about the flu shots. We should just say that like there were 300 pediatric flu deaths last year's unusually severe flu season. This season sounds like it's worse. 89% of the victims were not fully vaccinated. And again, this is about, maybe it would be helpful for you to sort of just discuss the concept of public health versus like individual health, because
your choice, right?
Yeah, like we don't really hear that much about there's a difference between those things. They're not necessarily oppositional, but there's a difference. I mean, if we were all to pursue our own interests exclusively, we would all take antibiotics for anything. But 10 years down the road, antibiotics aren't going to work for anything.
No, I mean, look at what's happening with gonorrhea right now. We have so many antibiotic resistant forms of gonorrhea. Recently, they were able to come up with 2 new antibiotics. So we've got a little bit of breathing space, but we know that gonorrhea mutates quickly and we have to stay ahead of it. But, you know, to your point, Sam, about public health versus individual health, it's not one or the other. They go together. Public health is about having clean water, clean air, preventing the diseases that you can prevent. And vaccines are one of the greatest public health victories in the last century. If you look back to the early 1900s and the deaths from the flu pandemic, from diphtheria, from tetanus, from all of these things that we don't even think about anymore because we just get the vaccines and we don't have to worry about it. Vaccines are a victim of their own success, which gives us the psychological freedom to think that it doesn't matter to us as individuals, but it does. Because if we're not all pitching in and we're not all doing what we can, it makes the most vulnerable amongst us more vulnerable. Now, it is important to ask, to have conversations with your healthcare provider if you can, to seek out good information from places like the American Academy of Pediatrics if you're looking for childhood vaccines, like the American College of Obstetricians and Gynecologists if you're looking for vaccines when you're pregnant, looking for good data so that you can make good, informed decisions about your own healthcare. But pitching in and being part of that public health solution is integral to your own health and the health of your family and your community.
There seems to be like, you know, a question of like, where is the burden of like, on what side of a ledger are we going to err? And maybe err is the wrong word, but it really is like, where is there a burden? Because we have moved from a more or less like opt out type of situation where like, you know, you have the ability to say to your doctor, I want to, I feel very strongly that I want to delay the hepatitis vaccine for my newborn baby. Like you have the ability to advocate for yourself in that regard. Mm-hmm. But it seems like we've now flipped it on the other head, where if you know nothing about medicine, you just know you want your kid to be healthy. It is now incumbent upon you to learn what you don't know, which of course is very difficult, right? Because I don't like, what am I going to start doing?
Complicated.
It's complicated. It's not like buying, you know, it's like, it's even harder than buying a stereo in the old days. But honestly, that's the dilemma here, because the incidence of hepatitis is going to be higher in low-income communities, in communities where they have less contact on a regular basis with a doctor. Maybe they don't have as many people in their social network who have exposure to medical training and whatnot. And we are essentially increasing the responsibility on these people who have less assets and resources to know what they need to be healthy, and at the expense of really just sort of an ideology.
Yeah. And they can't get access to the healthcare and the information that they need. That's why we vaccinate for hepatitis B. Because if we could screen everybody and everybody came to the doctor for prenatal care, then we probably wouldn't have to worry about it. But even though we do screen our patients who come for care, there are a lot of people who don't get prenatal care who get inadequate prenatal care. So that's the reason we vaccinate everybody. And I can tell you as a mom, I have 4 kids. My oldest is 26. When he was an infant, that was when we first started vaccinating against hepatitis B. I was reluctant to vaccinate my little baby. It's scary to look at that newborn and think, I'm going to put a vaccine in him. I get it, Maha. We want the best thing for our babies. And often the best thing is getting the vaccine and doing it in a safe way, with shared decision-making, making sure that you understand what's happening and what the best thing is for your baby, for you, for your family.
Let's just going through what they have rolled back. It was the flu shot. It was CDC's no longer recommends hepatitis A vaccination for children ages 12 to 23 months. And now CDC previously recommended meningococcal.
Meningococcal.
Thank you.
I got you.
To adolescents with the first dose at age 11 or 12 and a second dose at age 16. And now they're basically rolling that back to just sort of like special cases.
Yeah, so get ready to see more brain infections in young people that are obviously devastating, life-determining. I mean, they can kill you when you are at your most vibrant and best. It's just shocking to me that they can just literally, with the sweep of a pen, just get rid of it. People will die. Teens and people in their young 20s will die because they're not vaccinated against these things.
And we have no idea, like, why, right? I mean, not so much we have an idea why, but like we have no idea why they've decided that the meningitis vaccine is too dangerous for 11 and 12-year-old and 16-year-olds. They do recommend it for first-year college students living in residential housing. They do recommend it for high-risk groups, but to make that determination that it has value to freshmen at a college, for instance, versus not other people, they would have to say that there is a downside, like a risk associated with meningitis that outweighs the benefit that they're conceding exists for freshmen in college. And so, but we have no indication of what that is from them.
We don't know. The best explanation they've given us is that this is what they're doing in Denmark. But if you look at the actual childhood recommended vaccine chart, and you can find it at aap.org, there's a chart, and then there are like 17 pages of footnotes and links and data and evidence that help you understand what these diseases are and give you more access to why we vaccinate against these things. But that isn't at all part of what came out yesterday. And I think that's really telling. I mean, obviously it's telling. If they can only tell you just because we said so and somebody else is doing it, that's not great advice. We need better. We have to have better from our public health leaders in this country.
I think this is from the Times. The review compares, this is speaking of the review, it's a 34-page review authored by Tracy Beth Hogue, acting director of the FDA's Center for Drug Evaluation and Research. And they have, and also Martin Kulldorff, who have all long opposed vaccine mandates advocated for reducing U.S. childhood vaccine schedule prior to their roles in government. Their review compares the U.S. to nations including Australia, Canada, Finland, France, the Netherlands, Norway, and United Kingdom. The review claims the U.S. outpaces them in the number of recommended shots under the previous schedule. Most of the named countries recommend nearly an identical list of shots. I mean, so this is a polite way of saying, like, even on the basic facts, this review is just wrong. Aside from not addressing the differences in healthcare systems, because this is, again, like, if I have a concierge doctor who is with me and I'm going to see every quarter for a checkup, the advice they give me is going to be more specific and tailored and can be more nuanced and can get down to like very granular risk reward analysis based upon, Sam, you hang out in the subway a lot, or Sam, honestly, like you like to go to parties. So it can go down to that granular level where, you shouldn't be taking Tylenol as much. You shouldn't be, it could be anything, but we're not talking about that at all with our system.
No, especially if you have a concierge doctor. I mean, they are there to cater to the tiniest concern. And if they don't know the answer, they can get all the tests. They can get all the imaging studies, all the blood work, because you have access. You have resources. But on a public health level, think about the people in Flint, Michigan, who were drinking that lead-contaminated water for so long. Brown stuff was coming out of their tap. That's a public health problem. What do those people do? Many of them didn't have access to a physician, but they didn't even have access to clean water. What do you do in that situation? Clean water equals vaccines in this scenario. We have to make sure that we've got the floor for everybody. And then when you start making those individualized healthcare decisions, is this vaccine right for me? Is this medication right for me? Should I be doing this screening test? There are so many questions we can each ask about our individual health, but public health is for all of us.
The rotavirus vaccination. Rotavirus was the leading cause before vaccination of severe diarrhea in young children. It hospitalized between 55,000 and 70,000 annually in the United States. Deaths were between 20 and 60 annually. Vaccines now routinely administered to infants became available in the late 2000s, protect 9 in 10 recipients from severe disease. Now federal officials say parents should make their own decisions in consultation with doctors. But again, it's like, I've been a parent of 2 kids, and I cannot imagine a scenario where it would occur to me to ask about the rotavirus.
Right.
Like, if it wasn't for this job, I wouldn't even know what a rotavirus. I would have never read the word rotavirus. It doesn't come up in any type of. And I would say also RSV, which I had never heard of it until like the past 2 or 3 years. Maybe because COVID was in the air and maybe I was reading more. But it is the respiratory you would know how to pronounce this.
Let's just call it RSV, Sam.
RSV, a rampant pathogen, infects nearly every young child and is the leading cause of hospitalization in children.
Yeah.
In recent years, all children were able to gain protection for the first time through maternal vaccination or monoclonal antibodies. The existing recommendation doesn't change under the new guidelines. But the administration says it only recommends RSV monoclonal antibodies for certain high-risk groups. But that includes children whose mothers did not get vaccinated during pregnancy. I mean, this is, again, we are just sort of like putting more responsibility on non-doctors to it's very similar to the idea of like looking at patients as consumers, as if like we all have enough knowledge about medicine to make an informed decision on, I think you're using the wrong suture. I don't know what it's crazy.
It's overwhelming from a patient perspective. I'm a doctor, but I'm also a patient. And as a patient, as a person who's living in this world, you think you're going to be fine. Maybe I don't need that vaccine. I'm probably not going to get rotavirus. I'll probably get through the season without the flu. If I do, I'll be fine. Some people aren't fine. And you're gambling with your health. But in this situation, you're gambling with your child's health. I don't know if any of your kids ever had RSV, Sam, but I remember two of my boys had bad asthma. And when they got RSV in the winter, it was brutal listening to them breathe, trying to get them through these coughing fits and just being worried that they weren't going to get better. So these vaccines have been game changers. And I can see that as somebody who's had that experience. But when I'm talking with a new mom who's thinking about the future, she's thinking her baby is going to be fine, that her baby's not going to get sick. But when it really does happen, then it's too late for these vaccines. So that's another part of the conversation that we need to make sure that we're having. But you can only have it when you have access to a healthcare provider that you trust. And if you're relying on what you're seeing on social media, there's so much misinformation out there, and people they know some of it is misinformation, but they don't process it that way. So they still follow this advice that points them in the wrong direction and causes them to make decisions that are not in their best interest. Our healthcare system is so fundamentally broken. This is just one symptom.
And as of now, my understanding is that insurers are still going to cover these vaccinations.
Well,
but as of now,
if they are on the CDC schedule, Dr. Oz said. But he didn't say if they're on the American Academy of Pediatrics schedule or the American College of Obstetricians and Gynecologists schedule. So with this cut in the number of vaccines and the change in timing, I think it remains to be understood whether they will actually be covering these vaccines in a way that is meaningful and actually effective.
Well, right, and we're talking about both. It's also, we don't know relative to like private insurance versus Medicaid,
right,
or Medicare for that matter, or S-chip, or it could be different across those boards. I mean, I would imagine it's going to be interesting to see the difference between private health insurance coverage and public health insurance coverage, because I suspect private insurance, when they don't have the ideological factor in there, may just find that like long-term risk pool, it's going to be cheaper for us to pay for the vaccinations than to deal with any of our people that we're covering, to deal with these actual diseases.
It's why
viruses.
they covered IUDs or other birth control and things like that, because even if it's not the Republicans or whatever administration are ideologically against it, it's better for preventative medicine that way. But there's also this lawsuit, right? Because back to just the process of what Sam's talking about, they apparently didn't follow this law, this Administrative Procedures Act, where they're supposed to basically make it clear why they're making these determinations. So I wonder if the lawsuit has they're trying to speed past it or something like that, and if that affects private or public health insurance too.
Yeah, that's a great question. And so many of these battles are being waged in the courts right now. But back to your point about how insurance companies think it's a great idea to invest in preventive care, hey, I'm going to push back on that, because in my experience, whether we're talking about vaccines or IUDs, insurance companies and hospital systems are just thinking about making it to the end of the year. Because what might happen after that is their patient might leave. Their patient might switch insurance companies or go to a different healthcare system. So they're just trying to do the most budget-friendly thing right now, not actually invest in your healthcare, in the future of American healthcare. So ultimately, failing to provide these vaccines will cause an increase in the number of preventable illnesses, which will raise costs overall for all of us in this country, right, where we already know that we have the most expensive healthcare in the world and the worst outcomes amongst all of our peer nations.
Dr. Kristen Larley, OBGYN and chair of the board of the Committee to Protect Healthcare. But thanks for your time today. But what what should people do in this instance? I mean, I think like maybe it's my own sort of like bias, but I suspect that most people in our audience, at the very least, are will listen to this stuff. We'll listen, we'll read deeper into it. We'll the vast majority will be sensitive to this stuff and be in an opportunity to advocate for themselves and to find the vaccinations. It may or may not be prohibitively expensive because of these decisions. But what should people be doing, I guess, on a political level? Because as on an individual level, I mean, I think it's sort of like undermines the point, is that we should not have to be fighting to, or going to a learning annex to find out like what diseases are more preventable and where there's vaccines that are available to us to deal with something like this.
It feels overwhelming, but there are a couple simple things that we can do. So as patients, instead of turning to the CDC, which is where I always used to go as a doctor to find guidelines and information, I know I can't count on the CDC anymore because it's been compromised. So I go to my professional organization, and as patients, we all can do that too. So it's the American Academy of Pediatrics if you're looking for information about your kids. It's the American College of Obstetricians and Gynecologists for people looking for OBGYN care. It's the American Academy of Family Practice if you're looking for general care. Look to those professional organizations, the American Medical Association. They will have this information for you that you can trust because we are doctors and healthcare providers and we actually care. With regards to the political piece of it, I mean, there's one solution. We can't trust what's happening on a federal level right now. We need to replace these leaders with people who actually have the best interest of Americans in mind. And that opportunity is coming. We've got the midterms in November. We've got a presidential coming up in 2028. Now is the time to start building.
Kristen Lyerly, thank you so much. Really appreciate your time today.
Thank you, Sam. Thanks, Emma.
Thank you.
All right, folks. It's scary.
Yep.
It is scary. It is just also another reason why we need
Medicare for all.
Medicare for all, because not only obviously is it less expensive per capita in terms of spending, not only will it provide health care for more people, not only will it not, it will essentially remove that sort of like a side hustle you have of trying to get health insurance coverage for any given thing that you've done. But it also improves the relationship between you as a patient or a citizen and your healthcare, because you have a ongoing, more consistent, closer proximity, less obstacles in the way of having a closer relationship with your doctor or your healthcare providers. And it just makes for better outcomes.
Yeah, I mean, the truth is about the vaccine policy that it was actually a pretty impressive thing America did, but no one trusts it because we don't have a relationship with our healthcare system that fosters trust at all. And Abdul El-Sayed is the candidate that's been speaking explicitly to that. We can pathologize, and we do make fun of people like Brett Weinstein who do this anti-vax stuff, but it's a symptom of our private, healthcare system. And I'll just say on the Left Reckoning Bum Steer of the Year Awards 2025, RFK walked away with it in our member vote over Fuentes and Vivek Ramaswamy. 90% of people said it's RFK, so I think they're right.
With that said, your support is what keeps this show going. You can become a member at jointhemajority.report.com. When you do, you not only get the free show free of commercials, but you get to IM us during the fun half, and you help this show survive and thrive in 2026 with all of these pathogens around.
Yep.
That could do us in. Also, don't forget justcoffee.coop, fair trade coffee. Use the coupon code majority, get 10% off all your coffee needs. And speaking of Left Reckoning, Matt,
Yeah, coming up right after the show today, Jose Luis Granada Sea talking to David about Venezuela, and also Nick Estes of Red Nation, who I'm a big fan of, talking about a similar, the long history of America doing this to folks in the context of the Indian Wars. So check that out this afternoon.
Oh, we interviewed him a long time ago on this program, right?
Yep, he's great.
He's great. And speaking of David Griscom, Emma.
Yeah, so reading his book right now.
Tangled web.
It's phenomenal. He very I sent the link in the chat. David Griscom, very honored and humbled, as athletes like to say in post-game press conferences, that he asked me to moderate the launch of his book and the celebration of the launch of that book. We're going to have a conversation around an hour and a half on Wednesday, February 25th.
An open conversation.
Open, yes, where we just we'll deal with we'll battle each other on the ideas in the book. 6 p.m. Down on Avenue C at the Francis Kite Club in New York City. It's free. You could just reserve a spot, but you got to go to that link before all the spots fill up. It's the Eventbrite link that's down below in the YouTube and episode descriptions. The book is The Myth of Red Texas. It's very good.
I just got my ticket.
Nice.
I just literally...
Open conversation is the way of humans connecting.
Folks, see you in the fun half. Three months from now, 6 months from now, 9 months from now. And I don't think it's going to be the same as it looks like in 6 months from now. And I don't know if it's necessarily going to be better 6 months from now than it is 3 months from now. But I think around 18 months out, we're going to look back and go like, wow. What? What is that going on? It's nuts. Wait a second. Hold on for a second.
The Majority Report.
Emma, welcome to the program.
Hey.
Matt.
What is up, everyone?
Nomi Key.
You did it. Let's go, Brandon.
Let's go, Brandon.
Bradley, you want to say hello?
Sorry to disappoint everyone. I'm just a random guy.
It's all the boys today.
Fundamentally false.
No, I'm sorry. Women's...
Stop talking for a second and let me finish.
Where is this coming from, dude?
But dude, you want to smoke this 7-8?
Yes.
Hi, me? Is it?
Yes.
Is this me?
Is it me?
It is you.
Is this me? Hello? Is this me?
I think it is you. Who is you? No sound. Every single freaking day. What's on your mind?
Sports. We can discuss free markets and we can discuss capitalism.
I'm going to go throw up.
Libertarians. They're so stupid, though. Common sense says, of course.
Gobbledygook.
We fucking nailed him.
So what's 79 plus 21?
Challenge met.
I'm positively quivering.
I believe 96, I want to say.
857-210-35 501 1 half 3 8s
9/11, for instance.
$3,400, $1,900.
5 4 $3 trillion sold. It's a zero-sum game.
Actually, you're making me think less of
But let me say this. Poop.
You can call it satire. Sam goes to satire.
On top of it all,
Yeah.
my favorite part about you is just like every day, all day, like everything you do.
Without a doubt. Hey, buddy, we see you. All right, folks.
It's just the week being weeded out, obviously.
Yeah, sun's out, guns out. I don't know.
But you should know.
People just don't like to entertain ideas anymore.
I have a question. Who cares?
Our chat is enabled, folks.
I love it.
I do love that.
Look, gotta jump. Gotta be quick. I gotta jump.
I'm losing it, bro.
2 o'clock. We're already late, and the guy's being a dick. So screw him. Sent to a gulag?
Outrageous.
Like, what is wrong with you?
Love you, bye.
Love you. Bye-bye. We are back. Sam Seder, Evan Bigland. It is the Majority Report.
No side deals.
No. Did you put that through some type of like echo thing?
No, that's the tone from the actual video.
We've got to get a machine that will do that. That you can just like play around, like have
delay on
reverb or something like that.
A chorus of Schumer's saying.
And I want to have one of those machines that I can press a button and have my voice change, like a voice changer thing. This is like
Didn't you
Aaron
have
Brown
that?
have that?
That's what we should prioritize.
I broke it.
We should prioritize that over, the lighting and the cameras.
Who needs that? This is an audio medium.
Honestly, audio is the most important part.
Yeah.
What are we doing?
What do you
It's
mean?
not like what?
Our audio's not that great either. No, I'm
But
joking.
once we get that
The
figured
audio's
out,
not that great, but that should be prior. But it's also like, what do you like? It's not like this is like we're doing action sequences here. Like, you need a special camera to do this? We're just sitting here.
Yeah, I know. I know we're just
You got an
sitting.
issue with cameras. I was talking about how much I love Breaking Bad cinematography, and you poo-pooed that too. What's the
Yeah,
deal
it's
with
just
cameras?
like, so what? Come on, that's not. It's just it's a
Such a radio
distraction.
guy.
It's a distraction. No, it's not. It's not radio. It is that I just think that when you get too caught up in the visual part of it,
Marshall McLuhan over here.
yeah, there is just a lot of manipulation going on that is.
We wouldn't want to risk getting too caught up in how good the show looks.
It wouldn't look too good.
Yeah. I don't know.
Too well. We don't want to be too well lit.
Yeah.
It's just a distraction at that point.
I was hired to be the eye candy, and I can't even do that on camera.
Look, the beauty of 720 is that we get a lot of margin.
Okay, well then we'll put me in great lighting, and you can sit over there.
That's the point. Exactly. I'm getting too old to do 1080. I'm not doing that.
We don't even do 1080. We're at 720, baby.
That's what I'm saying. I don't want to do
2010
Nice
forever.
Nice soft 720.
Exactly.
Like a thin 720.
We can go 4K, but I'm going to need the stocking over the camera.
Great.
That's what they
Vaseline
used to do. They used to put stockings over the. Did you know that?
Over cameras?
They used to take
To soften
pantyhose.
lighting?
They would put pantyhose over the.
That's cool.
Yep.
Used to be able to do that.
For woke.
You can do whatever you want with the camera.
Noel from San Francisco. Sam thought movies were a lot better before they added sound. Chris Burdick. Sam, I love your commitment to acquiring all the equipment and sound filters necessary to turn MR into the drive time morning zoo. Thank you. Stephen Miller's hairline.
Sam and the candy.
Sam talking about cinematic quality as he speaks into a Wii remote microphone and looks at his flip camera lens, his peak. Put Vaseline on the lens for Sam, says Snarkorsky. And Out West says, I will not be happy till Sam is in 4K. Honestly, like the current technology is going to have to be like 32K before we get anywhere near 4K. That's the way I do everything. I like to be at least a decade behind. I do that with
We're now 2 decades behind.
I said at least.
Yeah, there we go.
Right in the sweet spot.
Which number is this?
I mean, if we want to, like, what do you want to do? We could do.
Oh yeah. Well, let's stick with the. This is the. No, let's go to the. I want to do these 2 vaccine ones.
Okay.
Here is Cheryl Hines and Tucker Carlson. I don't know what to tell you, folks.
She's still around.
Thought
She's
leaders.
stuck around after the Nuzzy scandal.
Yeah. Sometimes like when you're faced with a choice like that, you've either got to like, you either cut bait or you just like, you swallow the entire fishing pole, as it were. And she has done that. I mean,
entire bear carcass.
Exactly.
And everyone would
Despite
be like,
her husband sounding like the one who actually swallowed the entire fishing pole.
well,
I wouldn't read Substack for a while, Cheryl. It's not.
It's all lies.
It's all. There's no
that poem doesn't even
editors.
sound like me.
she's like, I thought I was the only baby bird that you wanted to feed, and you're.
Oh my God.
The valley I wanted to. What is? Never mind.
I obviously didn't write that. That is.
Doesn't even sound like me.
Invoking a fowl? Actually, it sounds exactly like you. Anyway, keep going.
Here is Tucker Carlson. Now, I wonder, listen, I have met Cheryl Hines once, very briefly, and she seemed perfectly nice. I don't know really anything about her, but I know that Tucker Carlson can't be this stupid. She could be, but she also probably has some very motivated reasoning behind this, and Tucker Carlson probably does too. But this is embarrassing that they're pretending like, I mean, look, well, play this.
You know, I didn't ever have very strong feelings about vaccines one way or the other my whole life. I never really thought about it. I didn't realize that it was a religion to a lot of people.
And political.
Well, but that, it's religion because that doesn't make any sense. If the vaccine is effective and you take it, then you're good to go.
Right.
Why does it matter if I take it?
If somebody else does it.
Did anyone, I heard smart people make that case, people I thought were smart, but it doesn't make any sense just on the face of it.
No, it doesn't make any sense. And that wasn't enough for people.
It wasn't.
No, it wasn't enough for someone to be able to take the vaccine and feel like, woo, I'm okay now.
100%.
I don't care what you do.
Right.
It wasn't enough.
So the my body, my choice was not a real thing, it turned out.
No, it was like, and I need to get involved with your body.
Yeah, it's your body, my
Yeah.
choice.
Your body, my choice.
I didn't.
Yeah. So there you get Tucker Carlson quoting Nick Fuentes. But aside from that aspect, I actually think, just in replaying that clip again, that Cheryl Hines not that bright, that she's not picking up on what Tucker's saying at the beginning. It's like a religion, but it's also political. Well, yes, I think that was what
Religious guy Tucker Carlson.
Yeah, didn't he say that demons scratched him in the middle of the night? And we're trying to say that there's we're dealing just in the realm of facts and reality.
And how could the demons have got to him when he was sleeping with his dogs?
But let's just use, for instance, the flu vaccine as an example. Flu vaccines, all the time that Tucker Carlson was growing up and taking them, they were never 100% effective. They were never probably more than 75% effective. Most years they range in efficacy between 45 and 75. Now they will have they will mitigate the impact of flu, but in terms of your resistance to it, but there are so many factors in terms of if I have the flu and Emma has been vaccinated, there are so many factors that are associated as to whether she will get it. It could be the strain of the flu and her own body physiology as to whether she's more susceptible to this one than another one because of the way that the flu is constructed. It's our proximity. It's, how much I exhale during this. It has to do with the airflow in here. It's like anything else, it's Swiss cheese. If you're driving down the road and you're going 90 miles an hour and you don't have a seatbelt on, your chances of dying are still relatively remote because you got to get into a car accident. Maybe a deer crosses, it could depend on the season, how many deer are out there or what the weather is like. But if you have a seatbelt on, your chances of dying go down, even if all those other factors are the same. If you slow your vehicle down, your chances of dying go down even more.
Right.
Even if those other factors are the same. we understand this concept in every other arena, but for some reason, people pretend like it doesn't exist with vaccinations.
And there's the other layer of who you're protecting, right? I mean,
well, but that gets to the other
Yes.
impact. That's the individual one. The other one is that some people may care that like somebody who you work with might be more susceptible to certain things.
Yeah.
And even if you don't care about them personally, you may rely on them for business reasons. Or you may care about them personally and also don't want them. Like,
am I still a part of this example?
No.
And old numb legs over here.
But like, so they somehow pretended, and I think, you know, the part of the problem was that by the time people were promoting the COVID vaccination as being prophylactic in terms of it had mutated, so it was less of a prophylactic.
Yeah.
But it still is a prophylactic. But even still, you layer your protections, vaccination, masking. Like, I wear my mask on the subway, or if I know I'm going to be in a more crowded area, not just for COVID, but also like, I don't want to get the flu this year either.
Right.
And
this flu has been incredibly, incredibly rough. I mean, we talked about this in the interview, but like, I think record hospitalizations in New York City.
Yep. And then there are other things that you can do to mitigate your risk. But the point is that there are people who can't get vaccinated. There are people who, because their immune system is compromised. And also, no vaccination is 100% effective. I mean, I think like if you get 2 measles vaccinations, you're pretty close to 100% protected. And maybe you don't care that there are kids who are dying or kids who are getting seriously impacted by measles because their parents were too stupid or, you know, were hoodwinked by morons like this.
I mean, is it surprising, I guess, in the country that does not that has a libertarian approach to healthcare, that's, I guess, where we ended up here? Like, people's right to own a gun has also trampled just basic public safety in this country, where we have more guns than people and they're hoarded by a bunch of nut jobs for the most part. And we decided that that takes priority over like children in schools being safe. And then the stupid whataboutism that she's not smart enough to pick up on from Tucker Carlson about your body, my choice, and like, you know, sneering at it, trying to get this woman to engage with that, or a Hollywood woman at that. The dude is like, you know, incredibly opposed to abortion. In terms of public figures on the right that have been like vocal about not believing in a woman's or person who can get pregnant's right to choose, he has been all across that. He said this just a few months ago, that he's, quote, totally opposed to abortion at TPUSA, that event just a few months ago. He called it murder and human sacrifice and got into some fight with like a student at the TPUSA event. So this guy, like, he throws that out there because he's trying to, whatever, discredit the left. But you don't believe in my body, my choice. You believe in religious fundamentalism, as you say, like, oh, it sounds religious to me.
It's stupid to think things for religious reasons. That's why Tucker Carlson's beliefs about abortion are stupid and can be dismissed.
But like, and then so they pretend they're interested in real conversations, but he goes on, he puts her, he invites her on there because he knows she's ill-equipped to like call out the hypocrisy that we're saying right now. And he tailors what he says. He's not talking about demons scratching him in the middle of the night with Cheryl Hines. He's going to use that, like those tactics to try to appeal to her because he knows that she's not able to push back.
And I do love the idea that he is denigrating religion. I mean, that's what he's saying.
They
And
always
meanwhile,
do that, yeah.
this is
You know, Marxism's a religion. It's like, if it was, you would be it.
All right, let's just also play this clip too, because this one's going around. Here is Robert Kennedy Jr. And I have to say, you know, like I think people know I used to do a show with Robert Kennedy I guess maybe the last one we did was about 10 years ago, and was friendly with him. We didn't hang out, but certainly was friendly.
Did you ever
And
pull-ups at the airport with him?
and I never did pull-ups or push-ups at the airport with him. I am still sort of. He always had this stuff about vaccinations. At different times, it was sort of more it wasn't foregrounded, rarely at all in our conversations that we had on air or even off air. We had one conversation where, we had an argument about it because I disagreed with him. And I had said to him, like, they took thimerosal out in 2002, 2003 out of most vaccinations to see if that would impact autism rates. And it didn't. And then his claim was that they actually didn't take it out, thimerosal, that it was some type of and I don't know that that's his line anymore. I think he's gotten more sophisticated but he has a belief, talk about religion. He has a belief that he is absolutely sure of. And I think it's also, frankly, reinforced on some level by the adoration that I think comes from specific communities that really see him as some type of champion for them.
And I also think maybe some people should pump the brakes on if pumping themselves full of testosterone and human growth hormone, especially when they're an older person and there's very little understanding of what effect that has on the brain. Just speaking generally.
I mean, I would not be surprised by that, but I think there's also.
I think you should triple it.
I think there's also. Max. I mean, there could be a lot of things going on. I mean, I think who knows how often people replace addictions with other addictions that aren't necessarily less as socially dysfunctional or obvious. Who knows? I really don't know how to explain this. I do know that he is very good at making an argument with stuff that is not true. And I don't know if he believes it or he doesn't, but this stuff he is eliding the truth very smoothly here. And of course, it's hard for people, I think, unless you are well-versed in this stuff. And I have the advantage of hindsight in this dynamic to assess this. But listen to this, and then I want to break it down from an infectious disease doctor who responded on Twitter.
But people said to me during the hearing, this link between autism and vaccines has been disproven. None of the vaccines that are given during the first 6 months of life have ever been tested for. The only one was the DTP vaccine, and that one study that was done, according to the Institute of Medicine, the National Academy of Sciences, found that there was a link. They threw out that study because it was based upon CDC's surveillance system, VAERS, and they said that system is no good. I think it begs the question is, why doesn't CDC have a functional surveillance system? We're going to make sure they do have a functional surveillance system. Right now, the surveillance system is the system that...
Okay, wait a second. All right, see, now what's interesting is he started to say that there had been no tests for autism with childhood vaccines given in the first 6 months. Now, it's unclear from even that sentence structure, what he's talking about. The tests don't take place
in the vaccine.
Are you testing for autism in the vaccine? Are you testing? I think what he's supposedly saying is these vaccines that we give kids in the first 6 months are never tested as to whether they create autism in kids. I think is what his argument is. Now, that's a lie. That's just not true. According to Jake Scott, MD, and also, frankly, the community notes on this, infant vaccines have been studied for autism across massive populations. A Danish cohort followed over 650,000 children. Studies of cumulative antigen exposure in the first 2 years found identical levels between children with and without autism. Thimerosal-containing vaccines were compared head-to-head with thimerosal-free formulations, no difference. A 2025 WHO systemic review of over 30 studies across multiple countries reaffirmed no causal relationship. And then the VAERS thing we talked a lot about during COVID. VAERS is the equivalent of a community bulletin board. And you can go up to that community bulletin board and pin up any type of like complaint you want. That is, in some ways, like the outermost bounds of what is possibly could be wrong with, in this instance, a vaccine. It does not suggest any causal connection. It simply suggests that people who have been vaccinated, which is, still most people, back then, the vast overwhelming majority of people, and anything that they go through after that, they could basically tack onto that board. It is.
So if you do an unprecedented vaccination campaign, you might expect there to be a rise in VAERS reports.
100%.
Right.
Of course. But that does not provide any assessment of causation. It does not provide any type of a control group. The Institute of Medicine reviewed that VAERS, extrapolation. I wouldn't even necessarily call it a study. It's more like a self-selecting survey.
VAERS, yeah.
And found it seriously flawed and uninterpretable. So it wasn't just like thrown out by the CDC because they didn't like the answer. They threw it out because it wasn't in any way scientific. It was really just like, sort of like putting a call out for leads. Right.
Police where like 99% are going to be complete BS.
Exactly. And that's basically what VAERS is. Let's get the entire universe of potential things that, could be a function of the vaccination. The consensus of independent researchers, the National Academy of Medicine, the American Academy of Pediatrics, and the WHO all found that CDC compilation was unhelpful in trying to determine anything. There's also, according to this doctor, an enormous body of MMR research, which is given at 12 to 15 months, not the first 6 months, to assess the safety of the MMR vaccines. So Kennedy is out there just sort of like pumping this misinformation. And I don't think it's even necessarily helpful to try and guess at why. Because sometimes you don't, first of all, I don't know if you can ever find a reason why someone would do this. I think there's a series of reasons that are probably so unique to Kennedy as a guy who, probably had one of the most public murders of a parent in the history of the world. I don't know. You probably come up with a dozen people, maybe. More so, who went through his own relationship with needles and addiction. So there's a whole series of reasons why this could be the case.
This is from a few years ago, but K-File found a bunch of old clips of him, like J.D. Vance comparing him to Hitler. It's like whenever say don't compare Trump to Hitler, it's all of Trump's cabinet.
I think that might be on the end of this clip. Oh, really? Yes.
that you know, one of the things that you
Oh, this is with
so
Taibbi.
beautifully, and your stuff is so fun to read, but you write about Trump. Well, the way that you build a truly vicious nationalist movement is to wed a relatively small core of belligerent idiots to a much larger group of opportunists and spineless fellow travelers whose primary function is to turn a blind eye to things. We may not have that many outright Nazis in America, but we have plenty of cowards and bootlickers. And once those fleshy dominoes start tumbling into the Trump camp, the game is up. When you talk about fleshy dominoes, Chris Christie comes to mind.
Yeah, exactly.
Yeah, that was with Taibbi. I mean,
Decent line.
wow. Oh, no, I think he's absolutely right. It's just,
Oh, I think Fleshy Dominoes was Taibbi's line, right? That he was reciting back to him.
yes,
maybe.
yes. He was reading a piece of Taibbi's back to him, and quite prophetic, actually. It's just that it's
nailed it.
You can't necessarily know who those people are going to be, though.
Always the ones you least expect.
Yep.
Probably should have kept that discussion for print.
Yeah, exactly. Where did I do with my sound sheet now? Can't find it. I need a new sound sheet because I lost mine. What's that? Yeah. Where the heck? Oh, this piece. This is interesting because Donald Trump says something, and this is, I guess, from a couple of weeks ago, but I wanted to play it. I think maybe we were on vacation.
Yep. He's talking about housing because right now it's absolutely out of control expensive.
I'm talking about housing, but I'm actually talking about one of the fundamental contradictions of capitalism.
But this, honestly, this is he actually makes a very interesting point here that they've obviously discussed in the White House. It has always been a general proposition that incumbents want asset values to remain high. Specifically, I mean, we're talking about housing, because it is the number one driver of intergenerational wealth in this country. Housing has been. Housing inflation has been insane over the course of the past 20, 25 years. Just outpaced all wage gains, et cetera, et cetera. I found it. Thank you. But thank you. It has outpaced all of these things. And the dilemma for an incumbent is that you want people to have accruing wealth, but the problem is you're also shutting out certain people. And here Trump seems to stumble on this. Now, these doctors, I think, are probably ready to whisk him away and give him another injection of whatever he needs.
It's like Clockwork Orange or something.
Yeah, exactly.
Just say rising tides lift all boats, Trump.
On housing, you talked in your address last night about housing. Yeah. Are you still considering a national emergency over housing?
I'm looking at it.
What would that look like? What would that mobilize?
You know, there's two thoughts on housing. You have a lot of people have housing that because we have...
Pause it. Just notice how desperately he's covering up that mark on his hand, particularly all those doctors there who would know what that is. Go back. He really,
Oh, it's super glue.
He looks. Yeah, I was gonna say he looks like a
First
kid.
thing,
His
I
mother
gotta
was
take
like,
my
"Stop
hand
playing
up."
with super glue.
Yep. Go ahead.
Still considering a national emergency over housing?
I'm looking at it.
What would that look like? What would that mobilize?
You know, there's two thoughts on housing. You have a lot of people have housing that because we have such a strong time and such a strong market, their houses are very valuable. It's a big part of their net worth, their house. I don't want to knock those numbers down because I want them to continue to have a big value for their house. At the same time, I want to make it possible for young people out there and other people to buy housing. In a way, they're at conflict. In other words, you create a lot of housing all of a sudden, and it drives the housing prices down. So I want to take care of the people that have houses that have a value to the house that they never thought possible, that have sort of made them wealthy and happy, and especially in their later years. Got to be careful with that. I want to keep them up. At the same time, I want to make it possible for people to go buy houses.
Daniel, please.
I mean, that actually is a dilemma for a politician in that respect.
I mean, this is Marx Capital Volume 1, exchange value versus use value. There's two thoughts on housing. One is the exchange value of it, and one is the use value of it. A lot of people depending on that exchange value of being able to sell it for a giant price.
Exactly. And the for the incumbents, and the incumbents in this instance can mean either the political class or the people who own the homes and have banked upon them as an investment as opposed to as a place to just sort of live.
Or private equity too, and all of the homes that they've purchased.
Private equity has buy the homes as an investment.
Exactly. I just mean it's not just boomer.
No, it's not just
homeowners.
individuals, but there's a whole, there's a lot of people who buy homes with the idea of like, okay, I'm going to stretch things a little bit because I know this is going to increase in value and I'm going to be able to flip it in 10 years and I'm going to move and blah, blah, blah. And there's other people who are like, I'm going to live here for the rest of my life until I die. And so, I don't really care what the value of it is, on the marketplace, because I'm never going to put it on the market.
What's amazing, though, is that this is almost like approaching what Kamala Harris and the abundancy platform of her 2024 campaign tried to do, which was that she wanted to give out basically a lump sum payment for first-time home buyers, which wouldn't affect really overall the price of existing housing.
It would
elevate it. It would
up a
subsidize it. And so we didn't love that policy. We love that she was talking about housing, but we didn't like it. And this is what the abundance guys are a little bit more about, where they still want to keep it within the sphere of the private market with less of a public hand in it, with less of a take on corporate power. And eventually it's just not going to work. It's going to be like, we've seen this within the context of healthcare. Government subsidies can maybe create a Band-Aid for a little while, but the systemic problems of the financialization of the essentials of life needs to be addressed. And he'll never address it, but look how close that is to what she was talking about and what the abundance guys are talking about.
That's why he had that 50-year mortgage idea was floated around, because it doesn't affect the cost of the homes. In fact, it probably it actually increases the price of the homes because your monthly payment is lower, but you're indentured. You're basically locked into that for an extended period of time. 50 years is a very, very long time. I mean, 30 years is a very long time. But what it would also do is increase the sort of need for the house to accrue in value for you to get out from under that loan that you've been paying and to go somewhere else. I mean, the bottom line is that why have homes? If you're really going to address this, outside of basically providing government housing, not like no profit incentive housing for people who can't afford to live, which is, something that we're going to have to do if we're going to solve any of this. But the other aspect of it is we have such intense wealth disparity that the failure of our society to provide for needs and for just financial security has put so much pressure on homes being the sort of number one generator of that security down the road. And that wealth transfer, the financialization of homes has made it virtually impossible for people to afford homes unless you're already in a home that has accrued that value.
Yeah.
That you can, sell that one and downsize or whatever it is.
But yeah, I mean, also this is the way he phrases it is emblematic of the major problem right now in our society too, which is that the boomer generation is hoarding everything. And people who are younger are having a really hard time getting by. And there is and then those same people are kind of the ones who are in power at this moment. And they're doing the grab bag capitalism thing right now, protecting the interests of their cohort and basically really the business owners, the people who are at the top of these financial firms, and we'll just see how bad it gets for everybody who's essentially under 40.
I mean, like China, we used to make fun of them for overproducing housing. Like that's like over the past like 25 years, it's been, look at how they've built too much housing that they can't adequately like sell it at a profit. Like that's the problem.
Well, but that's
that
the
they're
point.
facing. Exactly. Yeah.
You have to.
They don't care about that.
This is an either or situation. The reason why China is able to build that much housing is because they basically say to the private sector, you're not going to make a profit on this. That's it. And we have no comparable structure to build housing in this country that doesn't have a profit incentive. It's just, that's not the way our system works. And, but it's the reason why it's gotten out of control, so out of control, is because of how financialized of a product homes have become.
Yep.
And the flipping, the hedge funds, all of that juices it. There should be, and we could, I mean, look, we could really discourage both homes as an investment, like a quick speculative investment, like flipping and hedge fund. We could seriously inhibit that through the tax code. And we could also inhibit it through the personal tax code. You know, right now you sell your home, you get, I think the first $250,000 of value goes tax-free. It's not subject to capital gains.
Yep.
And then it's our minimal capital gains tax. But you could really increase that capital gains tax significantly over, over 250, so that you essentially get nothing over that 250. Or you could also say it's not just a question of if it's accrued $250,000. You could say, you could have the tax code being like, you're eligible for, if it's been 10 years, you don't pay any money on that first $250,000. But if it's been 5 years, you don't pay any money on the first $100,000
yeah.
of accrual. You could actually pace how much value accrues in the homeowners of that home by using the tax code. I don't know if we have politicians largely that are willing to do that because, as Trump suggests, he's got multiple constituencies and they are at loggerheads with each other.
Yep.
Let's go. I'm going to call in.
Good idea.
We haven't taken a phone call in 2026 yet. Oh, do we have to plug in the thing? I bet you Matt hasn't done that. Uh-oh. Oh, shoot.
What?
I didn't restart that computer thing.
All right, well, want to do it tomorrow?
No, I want to do it right now.
Okay.
Oh, wait. Wonder if that'll work, if I can talk about something.
Okay, I'll read some IMs. How about that?
Yes.
Resilient bastard. China did build too much housing precisely because it was being built as a commodity. What they've done differently from us is decide that they're going to keep people in their homes. That's the difference between their boom or bust and how we handle the GFC.
Yeah, it was still done through investors and speculation, but that all was focused by the state for the productive productive capacity, not the profit capacity.
Travis from Pittsburgh. If all houses got cheaper, then anyone selling their house could still move to an equal new house, given that its value is also lower.
But we want the money.
Yeah.
I want to be able to have my kids never have to work.
Todd from Raleigh. Emma, your earlier comment about the HPV vaccine with your friends took me back. My mom believes in vaccines, but stopped me from getting the HPV vax because she hoped it would deter me from having premarital sex. Yeah, that was a common thing. I mean,
2008 presidential debates. It was all over it. Yeah.
Yeah, 2008. I was 14, I guess then. So yeah,
Oh, jeez.
I know, sorry. And it was a big deal. I mean, my mom was like all for it, getting the vaccine. So I didn't have that issue, but I did have some friends. Same friends who, two in particular, one I'm still pretty close with, whose parents didn't let them go see An Inconvenient Truth when we screened it at in our school. So you know. Definitely not Cameron. I forget where I read this. I think it was tech and science outlets, Ars Technica. But one theory regarding RFK Jr. that makes some sense to me is that his ideology for his entire career was rooted in conspiracism and skepticism of authority from the assassination of his father. This also squares with his climate activism as being contrarian against oil and gas lobbying.
I mean, I always had a theory that was similar to that. He had so many people coming and whispering into his ear about the truth of in very prominent people.
Yeah.
Across the political spectrum, from, you know, wide range of people coming and whispering into his ear their theories about what happened. And I imagine that also made him skeptical. I also think his work as a plaintiff's attorney, you know, you go into discovery and you see what these drug companies, the way that the reason why they're putting out this drug or that drug, even after they are aware of this stuff, it never comes out in public because there's a settlement. Part of that settlement is you don't talk about what you found in discovery. And so that also, I think, could make you, if you're susceptible to it, can make you a little bit more conspiratorial minded. I think both those things contribute.
We don't have it on the sound sheet, but we do have that Tapper and I mean, it's the clip of the day, the Stephen.
Oh, yes.
Yeah.
We do have that on the sound sheet, don't we?
I don't know what happened. I put it in there.
I thought you put it in there. Oh, yeah. All right. Let's put this up. So we had talked about this earlier, that the Trump administration, there seems to be multiple different sort of like elements within the Trump administration that had an idea as to what should happen in Venezuela.
Yep.
Some wanted Machado, the
Maria Corina Machado,
the I guess the extant Democratic, I put in quotes, leader who wants to be the popular, the would-be popularly elected Nobel Peace Prize winning president of Venezuela, although apparently she doesn't have any support, and so
no, she doesn't have any support.
The expat she does.
Yeah. She had to, I think, flee. There were rumors that she was kind of ushered out secretly from Venezuela to go get her Nobel Peace Prize because she is so reviled. You're about to hear Jake Tapper make a claim about the 2024 election in Venezuela, where you will hear, and you'll hear this throughout our media, specifically corporate media, that the Machado party and what was his name, Eduardo Gonzalez, I believe, who was at the head of that party, that they beat Maduro by like 70%. It was overwhelming. The Western governments say that. Governments a lot that are opposed to like the United States say something differently. The claims about like these elections being fraudulent have been persistent. There have been very little facts that have presented that have backed it up, and the claims about Guaido having actually won were disproven.
Were lies.
So yeah, I guess technically we still don't know really what the full outcome is, but if we're going by past history, we know that Western governments repeatedly lie about this kind of thing. And so like regardless, she has been in the pocket of like Western NGOs for almost 20 years. There was a great piece by Gabriel Hetland from a few months ago in The Nation that just goes point by point with how connected she's been with the Republican Party and with American capitalists for so long, specifically Marco Rubio. And she just goes out and says it, as Sam was alluding to. we want to open up Venezuela for capitalists. We want to privatize everything. We want the Americans to come in. She was even cheering on the sanctions, which immiserated the population of the people that she says she wants to lead. So the idea that she has any real legitimacy is a fiction by wealthy Westerners who want to see that happen, or Americans in particular. And so, like, go on.
Well, the irony is that there's one sort of like major cabal within the Trump administration that wants to push that. There are others that, who knows what their perspective was, certainly for Trump, it seems like it could very well be, I mean, it's sort of hard to wrap your head around this, but it could very well be just sort of like a personal sense of like aggrievement that he hasn't been shown enough respect. I think there are others who feel like, oh, a Monroe doctrine of like American hegemony in this hemisphere is possible in the same way it was 150 years ago. And it will also help ethnically cleanse this country. Yes. And I think that's where like a Stephen Miller is. And so you have, Paul Wolfowitz was, I think, a Defense Department official at the time, an advisor, one of the early neocons, said that weapons of mass destruction was something that we could all sort of like agree upon for the invasion of Iraq. But that was helped by the fact that the country was still in shock out of 9/11, that there was a history with Saddam Hussein. The fact of the matter is, the American population has no interest in invading Venezuela, could not tell you why we would do it. No one could explain why.
They didn't do a multi-year-long propaganda campaign to lead up to. I mean, the Bush administration.
We did. The Bush administration with Hugo Chavez.
But they did. Well, yeah. But also, even the act of going to the United Nations and doing the song and dance manufactured consent and gave this like long runway for the media to build a popular consensus for our legal invasion of Iraq. But it is fascinating to see. You have Tapper, the thrust of this question, we'll play it in a second. You'll hear what I'm saying. And then I heard last night, because I don't know why I'm a masochist, I'm watching CNN, and John Bolton's on there with Caitlin Collins, and is like, saying the same, I don't understand why he's keeping the current regime in place. Like, Machado should be installed, because that's the old, that is the neocon playbook. Well, but Trump is uniquely narcissistic and motivated by spectacle, personal grievance, which we'll get to, I'm sure. But I really do think the spectacle of the perp walk from Maduro was what he was after. The guy that is obsessed with TV and all of this kind of thing. To send a message to Petro, to Claudia Sheinbaum, to all of these other leaders that we could do this to you too, and even to other people in Venezuela that may try to make sure that American capitalists don't ravage their country.
And we should say Bolton is such a rabid neocon that even a Republican Senate would not confirm him to be ambassador of the UN during the Bush years. A Republican-controlled Senate. Bush had to put him in a recess appointment at the United Nations. Hardcore neocon. And in some level, what he's saying actually makes some sense, Bolton, in the sense of why would you get rid of Maduro rather, and keep all the other Chavistas in there? It doesn't make any sense. Which may be true. It may not make any sense unless there's some deal for just one hedge fund guy, Paul Singer. We'll get to that in a moment. But here's Jake Tapper, and we're looking at two different types of lunacy.
Yes.
One, which in Jake Tapper assumes that there was any legitimacy to any of this in the first place.
Exactly.
And that it would be somehow better or more rational to put in Machado, who, by all accounts, would be installed as president, and then you'd watch the dissolution of the country, and you'd just end up seeing some type of military coup because she doesn't even have the backing of the people. And then you have, in split screen, another lunatic who thinks that it's 1912, and we have the ability to create all these banana republics up and down and enforce this sort of racial hegemony, and
conquest of the Western Hemisphere. This is the new line.
And it's primetime on CNN.
president was very quick to say that the recipient of the Nobel Peace Prize, opposition leader Machado in Venezuela, doesn't have the support in Venezuela to become the next president or the interim leader. And I wonder where he got that from, given that basically her cutout, Gonzalez, won the election last year, 2 years ago, overwhelmingly, 70% of the vote or something like that. Why does the president think that Machado should not be the next leader? Why does he think she's weak?
First of all of Venezuela experts agree, that it would be absurd and preposterous for us to suddenly fly her into the country and to put her in charge. And the military would follow her and the security forces would follow her. This is not a serious, it's not even a serious question.
So should there be an election?
Let me, if you give me the floor for 30 seconds, let me tell you what we are doing here, Jake. The United States, this is sort of foundational. The United States is using its military to secure our interests unapologetically in our hemisphere. We're a superpower, and under President Trump, we are going to conduct ourselves as a superpower. It is absurd that we would allow a nation in our own backyard to become the supplier of resources to our adversaries, but not to us, to hoard weapons from our adversaries, to be able to be positioned as an asset against the United States rather than on behalf of the United States.
Sovereign countries shouldn't be able to do what they want to do?
Pause it.
Monroe Doctrine.
Okay. So I'm just sorry. Sovereign countries shouldn't be able to do what they want to do. That was his follow-up, Jake Tapper. His initial question was, why don't you impose Maria Corina Machado on the people of Venezuela after you kidnapped their president? And he's pretending to care about sovereignty. And what's amazing...
The cutout guy won, though.
Right, won. As I just explained, that is extremely in dispute. But in American corporate press, it's repeated as fact. It's not fact. It's far from fact. In fact, it's most likely to be a lie. But like, what the fact that he goes there and then it tries to invoke sovereignty, that is an incongruent argument. If this America First crowd actually was interested in that kind of thing, Stephen Miller would have a follow-up here saying, like, what are you talking about sovereignty, right? Like we removed Maduro because he's a narco-terrorist dictator, right? But it's up to the people of Venezuela to make these determinations, et cetera. Like, you are talking about imposing this kind of thing. And he's unable to do that because he's arguably he's more insane than Jake Tapper.
But the point that Jake Tapper seems to be following two separate lines of questioning simultaneously and never completing either. You can either say, okay, I'm going to accept the premise that you have decided might makes right. Why are you not installing Machado? Okay. And he says, we're not going to do that because she has no support, blah, blah, blah. Well, if your claim is, again,
right,
Tapper just following one line of questioning that is coherent within itself, then what's your plan? Because you've gotten rid of Maduro, but you've basically put Maduro's cutout, to use his phrase, in office. What makes you think that the other Chavistas aren't going to continue with the exact same policies as Maduro? That should be the question. But he goes back and forth because Jake Tapper is so, I think, I mean, who knows? This is all speculation. But I think Jake Tapper does actually feel like, oh, no, it's perfectly legitimate for us to go do this.
Yeah.
And he's arguing as to the rationality of the plan, not from the perspective of the Trump administration, based upon their premise, but Jake Tapper's premise, which is we should have the right to install.
Exactly, and I just find it fascinating because Tapper, he's very well connected in the Pentagon, and that is what his perspective is, and that's it. When you see him on TV, know that 99% of the time his questions are representing the military-industrial complex, arguably more than any other anchor on that network.
Wolf Blitzer gives him a run.
Okay, well, yeah. I mean, Dana Bash.
All right, so go back just a little bit.
A nation in our own backyard to become the supplier of resources to our adversaries, but not to us, to hoard weapons from our adversaries, to be able to be positioned as an asset against the United States rather than on behalf of the United States.
Sovereign countries shouldn't be able to do what they want to do?
The Monroe Doctrine and the Trump Doctrine is all about securing the
It's
national interest of
Donroe
America.
doctrine.
For years, we sent our soldiers to die in deserts in the Middle East to try to build them parliaments, to try to build them democracies, to try to give them more oil, to try to give them more resources. The future of the free world, Jake, depends on America being able to assert ourselves and our interests without apology. This whole period that happened after World War II, where the West began apologizing and groveling and begging
I don't even
and
know
engaging in
Korea,
these
Vietnam.
reparation
About right
schemes.
now.
It's a
Oh, wait,
what I'm
go
talking
back, go
about,
back. You
Jake,
just missed the funniest part that Tapper.
We should be able to assert our interests without apologies. Like, I'm just saying, notice how he could have pointed it out. He could have said what we're talking about here. You are not making a congruent argument here, Jake Tapper. He can't, though. He's reverting to America. He says that we were giving our oil to the people of the Middle
Miller's saying that.
Miller's saying we're giving the oil to the people of the Middle East. So you're saying that's the revisionist history that we're going with about our wars of aggression in the Middle East? Sure. Okay.
Period that happened after World War II, where the West began apologizing and groveling and begging
I don't even
and
know,
engaging these
honestly,
vast
what you're talking
reparation
about right
schemes.
now.
What I'm talking about, Jake, is the idea. And by the way, you do. I know you love doing that smarmy.
We should be still colonizing the rest of the world. Well, that's what Miller's saying.
Yeah.
Like, you're talking to a white supremacist, Jake. Like, figure it out what he means by that. He means that, like, France should still be controlling Vietnam and et cetera, et cetera.
I mean, there's, and again, the obvious line of questioning for Tapper here, if he's going to elide the fact and is afraid to go to the place where, oh, what you're saying is you're talking about white Western supremacy, like as if it's of the essence of our God-given divine right. If you don't feel comfortable in that, Tapper's for whatever reason, because he's so sort of like I don't know. I think the ideology is so sort of neocon oriented. Is like, then what is your the next question is to competence. What's the plan here?
Yeah.
Because you've taken out Maduro, but like he had a government and you've just left the entire system of government. It's just a different Maduro in office.
And groveling and begging
I don't even
and
know,
engaging these
honestly,
vast
what you're talking
reparation
about right
schemes.
now.
What I'm talking about, Jake, is the idea. And by the way, you do. I know you love doing that smarmy thing, Jake, and I was hoping to be better than that this time.
I asked you about if there should be an election.
Exactly.
I asked you if there would be an election in Venezuela. That's what I asked. I said, why was the president so quick to dismiss Machado? You answered that question. And then I said,
the objective, Jake, is security and stability for the people of Venezuela. With our help and leadership, that country will become more prosperous than it has ever been in its whole history. Venezuelans
but the
will
woman
be richer
running Venezuela
and
right
safer
now is
and
part
more
of the Maduro
secure and
regime.
better off. There will be conversations, Jake, about all of these guideposts along the way. The reason why I was giving you that speech, which I know you didn't want to hear, is because you're approaching this from the wrong frame. This neoliberal frame that the United States' job is to go around the world and demanding immediate elections to be held everywhere, immediately, all the time, right away.
I'm sorry, we have to pause it. The neoliberal frame is not that we demand elections everywhere, you fucking Nazi. The neoliberal frame is the idea that we should be doing regime change all across the world and doing exactly what you did, but you just did it without a plan.
It's a neoconservative frame.
Okay, fair enough.
And he doesn't want to say those words. Because there are too many neoconservatives in the White House, and he just doesn't want, from a rhetorical standpoint, he doesn't want to concede what it is. It's a neoconservative movement.
It's a neoliberal versus neoconservative.
Words have definitions, you know, and he just doesn't want to use that. So he says neoliberal because he knows that is a word there. And he shifts from we are not going to allow a government to exist that is a supplier for our adversaries and is an asset against us, not for us. And then he goes on to claim that, like, we're doing this for the Venezuelan people, which, of course, is, in fact, a neoconservative, impetus.
But their disagreement is that Jake Tapper wants the pretense of elections and Stephen Miller doesn't care about that. Isn't that amazing?
I mean, to be fair to Tapper, he did go sort of like the next step. Like, then why did you leave the same regime in office?
Yeah.
And
because we're too weak to do anything else. That's the answer. And like the people like
Well,
Tapper
that's the
want to
point.
hit them
That's what's
for being so weak.
Utterly mystifying about all of this is it's quite possible Donald Trump did not have a plan. Like, it was just like, I want to get Maduro out of the way because he was dancing. And I didn't like the way he was dancing around me. And Putin had said I should do that because Donroe Doctrine. And now, okay, what is the Donroe Doctrine? I don't know.
Tell me more.
It's just like, I like the fact that it's Don. And Miller could be pushing the Monroe Doctrine, this sort of like neo-Monroe Doctrine thing that can't really happen unless you take the next step. And he realized at one point, like, oh, I got Trump to the trough, but I couldn't get him to fully drink the water. Lindsey Graham, who probably encouraged this, also realized, like, I got Trump to the trough, but I couldn't get him to drink the Machado water. And now they're just stuck. There's 12 warships off the coast of Venezuela with 10 to 15,000 Marines sitting on them, just sitting there going, like, what are we supposed to be doing here?
Yeah.
And nobody knows. Like, and the only other thing I can imagine is that there was a third or fourth, I guess, sort of like impetus, which was Francesca Fiorentini spoke about.
Yes.
Let's play this clip because there is, like, right now, who's the winner? Well, what's her face? Rodriguez, the new president of Venezuela is, she got a promotion.
Yeah.
Everybody got a promotion, one step up in Venezuela. Presumably they were not, they may have said a couple of words and gotten the promotion that way. Trump, I guess, perceives himself as a winner because he was able to take them out and only killed 80 people. And I don't care about them. They're barely people anyways. Miller got close to what he wanted, but he didn't get what he really wanted.
Yes.
Graham got close to what he wanted, but he didn't get really what he wanted. But I'll tell you who did apparently get what they wanted. A guy named Paul Singer. Francesca will tell us.
This hoe is at it again. Who is he? He is a hedge fund manager named Paul Singer, another mega Trump billionaire donor who is famous for doing things like buying the debt of struggling countries like Argentina for pennies on the dollar and then forcing that country to repay him with interest plus legal fees. And oh yeah, he's also famous for going fly fishing with Samuel Alito. Super legal, normal stuff. And in November of last year, Venezuela also defaulted on its bonds, and it was forced by creditors to sell the U.S. subsidiary of its state-run oil company, Citgo, that had been forced to actually buy its gas outside of Venezuela because of the U.S. oil embargo and sanctions. You know, the whole reason that Trump says the oil production in Venezuela has been so stifled, they weren't handling it properly. It was because of the sanction. This is like choking someone and then going, wow, you're having a really hard time breathing. Now, who bought Citgo? This same hoe. And because of the embargo, that hoe bought it for $5.9 billion when it's actually worth $18 billion. And yet, the Maduro government was seeking a court appeal for that forced sale of Citgo. But then, oopsies, Maduro was kidnapped and all bets are off. I wonder if mega donor Paul Singer had anything to do with it. Paul Singer also loves Marco Rubio. In fact, that was his first pick in 2016, again, because both of them have made a killing off of making Latin Americans poor. So, yeah, he's a hoe. Fuck that hoe.
I mean, that's as good of an explanation as any. Like somebody won. And it sure sounds like that, maybe the deal that they cut, that the new regime cut was, we're going to basically do what we did, but we're going to,
Yeah. And like Citgo, I think it has all these refineries, right? And the oil that comes out of Venezuela is very crude. And so that has different purposes than the oil that primarily we drill here in the United States, either through fracking, or we also obviously get it from Canada a lot. But the oil refineries that had previously been processing some of this crude oil need a little bit more product, and it seems like Citgo might be a beneficiary of that.
Let's go to the phones.
Nice.
Yes. And I'm using this new split view.
Wow.
Folks, the number is 646-257-3920. We got time for probably one or two calls. We'll do more tomorrow, I promise. It's just that, we had a lot to talk about on our way back.
This Chris Cuomo's fun.
What's this?
Chris Cuomo, number 7. It's bizarre.
Okay.
Okay, let's do this one. 646-257-3920 is the number. Here is Chris Cuomo trying to figure out, and again, don't want to pick on a guy who thought that things were going to be very, very different for him right now. Like
that 2026 is going to be a little bit different.
in January of 2025, February of 2025, Chris Cuomo is thinking, my brother's going to be mayor. It is going to be, it's going to be like it was when he was governor, but even better, because it's all going to be in the city.
Yeah,
And
not
we're going
Albany.
to party.
Ugh, Albany.
I'm not going to have to go up to Albany. I mean, this is going to be, they could take me off of CNN, but they can't take me off of being the mayor's brother. And now he's just all on News Nation. And what are you going to do?
There's a weird sentence in here that doesn't quite fit with the rest of what he's talking about. See if you guys can spot it.
Oh, so he's monologuing.
Sort of. They're now sitting in a New York City detention center. They are now the center of our politics. But every day that's the case is
Maduro.
another day that nothing is done or even debated
Non-binary
about the
Maduro.
fact, okay, not a feeling, a fact that a majority of Americans have fallen behind financially, and we know why. Choices that kept pay from keeping pace with the price of everything that we need, let alone want. And all the sturm and drang about what Trump did and why it is great or terrible, the American military should get more attention here. The American fighting men and women and those doing the strategy.
All right, pause it for a second. You need to go back and you need to put us into frame here, because because this is one of those things where you want the audience to understand you're not the only one who can't follow this.
Right.
It sounds like Cuomo is starting to make a populist appeal and saying,
Well, he's saying the troops aren't getting enough credit
wait.
now.
But before we get to the troops part,
okay.
he's making a populist appeal and starting to make it sound like he's saying that Donald Trump is a sideshow. The president of the United States invading a country and kidnapping its leader is a sideshow.
It feels AI kind
The
of.
real issue is wealth disparity. So let's follow where he goes because it sounds like he's sort of gone off the rails.
This is his clip, by the way.
Okay.
Or even debated about the fact, okay, not a feeling, a fact that a majority of Americans have fallen behind financially, and we know why. Choices that kept pay from keeping pace with the price of everything that we need,
Which were?
let alone want. And all the sturm and drang about what Trump did and why it is great or terrible, the American military should get more attention here. The American fighting men and women and those doing the strategy and tactics just proved they are the best in the world. They certainly sent a message. To pluck the hardest target in a country like Venezuela that has a lot of armed security around Maduro, and they are zealots, and to do it with mesmerizing quickness, virtually without a scratch, is impressive. Now, for all the criticism of whether they should have been there in the first place, of what this move means legally and politically, the message that the military operation sends to China and Russia is loud and clear, okay? And we see reason to believe about this in the response or lack thereof from those two parties, right? You basically got a mumble from Putin and China, who has a lot of money working in Venezuela and a lot of ambitions for that oil, and had a delegation.
I'm sorry.
It's AI.
Is it AI?
It has
to be AI.
It reads like AI. Or my other theory is
You're saying the script is AI.
Script is AI.
Oh, 100%.
Yep.
Or I have another theory. the person loading it into the teleprompter
yeah, I was gonna-
had two different monologues.
It forgot to
and it was like
select all
it
the rest.
switched at one point and it goes, oh shit, we're supposed to do the one about Venezuela.
Or they're still on cue cards, and every other cue card fell to the floor.
But you could take the income inequality part out, and it would still it would be stupid, but it would make some sense.
Yes,
that's what I'm saying.
It doesn't make any sense to have what the initial part about income inequality and like cost
If
of
you were
living
to do,
there.
if you were to do like a bullet point, it would go. People like to follow a lot about what Trump is doing, but the real experience of people is that wages are not keeping up with the cost of living. And so we get distracted by what Trump is doing. But the answer is that our military was very impressive in this abduction.
Go troops.
And China
God bless
and
America.
Russia are in no way even responding to what's going on because they were so impressed by our ability to kidnap a person in Venezuela.
It's almost like China and Russia aren't that threatened by taking out the leader and then keeping the rest of the exact same regime in place. And also, Putin just recently was like meeting with Donald Trump, and there's a lot of theories about how he appealed to him by saying the Western Hemisphere is yours.
Done,
You
bro.
just let me do my thing. Like that might make sense, actually.
Can you imagine like somebody, like some advisor to Putin in Russia rushing in going, you must watch this Chris Cuomo.
Yes.
He's figured it out.
To be honest, though,
You're in grave danger.
I can't believe how brave Chris Cuomo is, thanking the troops and praising them on television. That's never been done before.
Look, let's remember what matters is God bless the troops. They're
But
so
the, but the amazing thing is he
It's a
said
bad
like,
comic.
But the amazing thing is that he was saying like, look, you can get distracted by all this, but the key is wage disparity and unaffordability, except for the fact that our military did a great job with this over here.
Look at the secret agents over there doing special stuff.
They're so good.
Does he come back around to it?
See the rest of it a little bit more.
And China, who has a lot of money working in Venezuela and a lot of ambitions for that oil, and had a delegation on the ground when this operation went down. Yet what did they say afterwards? Oh, you know, we're prepared to protect our interests in court.
I said release
They
it.
could have done the same thing that Trump just did to Taiwan, but they didn't, at least not yet. They could have said, hey, Venezuela's an ally. This was illegal. We're going to give them military reinforcement, the way Russia did to Cuba in the 60s. Instead, Russia and China have both stepped back.
What? They both step back because they don't care about Maduro. They just want to make sure that the same government is in place, and the same government is in place.
They don't have the history of invading their neighbors like America does. And I will say, like, hypothetically, if China did take the opportunity of like America doing all of this crazy belligerent illegal acts to take Taiwan, we also wouldn't start a
And
global war
also,
over it.
we have completely lost any pretense of that's inappropriate. That's a
Don't do
sovereign
that.
country.
Yeah, I do like that.
Just because they're in your back door, your backyard, or whatever. Like, I mean,
The
we've
Giro doctrine.
I like the idea that like he got the message from his brother's law, so he didn't focus on affordability enough. So he's like, just stick it in
Just
anywhere.
paste it in wherever.
Just throw it at the wall and see what sticks.
All right, let's go to the phones. Calling from a 385 area code. Who's this? Where are you calling from?
Hi, how you doing? Is this me?
Yes, it is you. Who's this? Where are you calling from?
Hi, my name's John. I'm from Denver.
John from Denver. What's on your mind?
Yeah, hi. I just wanted to thank you guys for pointing out that area about what is the plan, what is the objective, what's the success here. My background is actually petroleum development. I'm a geologist, and I work for a company that does do evaluations and things for natural gas fields, oil fields, things like that. And so this has been on my mind quite a bit over the weekend, and reached out to a lot of my colleagues to kind of get their thoughts and trying to understand, you know, what is going on here, because the Venezuelan area is pretty unique. Emma pointed out some of the issues with the Venezuelan crude. It is sour. It has a high API, or meaning it's very viscous. So it's kind of hard to work with. So it does take a lot more money and energy to refine it. And something that we look at in our industry across different fields and regions of the world is what is the break-even cost to actually produce a field? Meaning, what is the price per barrel? And Venezuela's actually pretty high. It's in the 70s to 80s per barrel, whereas in the United States, we break even in the 50s to 60s per barrel. So right now, in the current price environment, and especially over the last year, the price per barrel has been falling because the global supply is so high. Even throughout the Biden administration, we were breaking records nationally on production. And so with such a high price environment, this seems kind of a haphazard, hey, we're all going to win, we're just going to have more oil, this will be great. But really the only people that stand as far as corporations to benefit is probably Chevron, the corporation that's already and has been there since the early 2000s, just because they have infrastructure, people, other things. But for another company to walk in and try to set up shop and produce to even bring a benefit to the country, the price per barrel is just too high.
Well, and
so it's always been really very bewildering to people in the oil and gas industry when we heard the president in his inauguration address say the words "drill, baby, drill" several times. We were like, man, we are $10 away from not breaking even right now, and now it's even worse. And so I think it's kind of a shotgun approach of, hey, we flexed our military might, just so happens there's oil there, Maduro's gone, and he's trying to feel out which of these things looks or sounds good to the American public. But to the oil and gas industry, it's kind of a it's not ours, but this just is not the economic environment that gets any of us excited at all.
I would also imagine that your calculations are based upon a sort of like frictionless extraction of that oil. And I don't mean in terms of like the actual extraction, but the idea that from a political and standpoint that it would be frictionless. And I'm not quite sure that that's the case based upon the various militias in Venezuela, that they would be, that there wouldn't be some type of like a nationalism that say like, we're not going to give away all this oil proceeds. But I also wonder, and maybe you have a perspective on this, like if I'm Putin and I am telling like basically Trump to, I've got two reasons to suggest to him that he make Venezuela a client state. One, it would perhaps diminish Trump's investment in Ukraine because, like, you're going to turn towards a Donroe doctrine, and you're not going to care about my backyard. I won't care about your backyard. But I also got to think that on some level, any disruption in the Venezuelan oil supply has got to benefit Putin because he's looking to sell oil and to drive the price up.
Yeah, that's definitely a possibility. There are, any bumps that do disrupt global supply. And that's something that a lot of people need to come to grips with too, is that it is a globally traded commodity. But that also can insulate it a bit from a missile strike from Iran to Saudi Arabia. You might see a small bump, and then the next week things are back to normal. So depending on how smooth things are, with a transition, or if it's just kind of business as usual for Chevron, that it may or may not matter at all. And if it does matter, well, that might only amount to a couple dollars per barrel increase.
So what is Chevron's refining capacity? Because like I'm reading just basically how this would take years for other companies to build up the infrastructure that they would need to drill this kind of oil. Like, can you expand on what that means?
Yeah, so I don't work as much in the downstream, but I do have a colleague in my office. He did work in Venezuela and told me a little bit about just that it is in pretty rough shape. Things have not been upkept the last 20 years that well. And so their capacity is generally diminished. And that does take time to build, change, upgrade, whatever it is that they need to do. And so that does add more money to the equation that it would take to make things kind of hum, if you will. But the product itself does take a lot more finesse or a bit more work, and that's what I think is kind of odd as far as the economics that don't make it, as attractive as American development.
All right. Appreciate the call.
Yeah. Thank you, guys.
Thank you.
Kowalski from Nebraska. U.S. gasoline refining in the United States was 18 million barrels back in 2010. Today, it's 18.3 million barrels. Our bottleneck is the fact that no refinery has any expansion projects underway. And why would you? You would lower the per unit cost of gasoline. This is why gasoline prices surge whenever we do massive construction. So seasonality in the summer, but even Inflation Reduction Act caused the price of gasoline to go up because we were tapped out of our refining capacity. Too much demand chasing too little supply. This is why U.S. is a major oil exporter. We'd literally be sitting on an ocean of it otherwise. That's always been the bottleneck. My argument was, and there was an attempt at one point to sort of like permit it, but the bottom line is it's just like too expensive of an investment for anybody to make in the oil refining because it's going to lower the value of the product that they're actually refining by expanding capacity. So my suggestion has always been if it's genuinely a national security issue,
yep,
we should own the refineries.
Kind of like housing.
And make it, and we determine what our refining capacity is at any time. And then that sort of argument that it's all about a national security issue sort of falls apart.
We need to represent Chevron because of national security.
Yeah.
All right. We'll take one more call. I know, but nobody was waiting very long. So calling from a 770 area code. Who's this? Where are you calling from?
Hello?
Hello?
Is this me?
Hello?
Hey, how's it going, guys? This is Ted from Marietta, Georgia.
Ted from Marietta, Georgia. What's on your mind, Ted?
So I wanted to ask you guys, what do each of you think happens to the millions of Americans who would be automated out of the workforce seemingly forever? Truck drivers, retail workers, fast food workers to begin with. If they have no leverage to unionize, how could they improve their material conditions? No leverage to protest the government or anything else.
I think this is why things like organizing around tenants' rights is becoming increasingly important. Is the one area you do have leverage is we have a rentier system where the rentiers need to get money from people for like housing, so you can organize around places like that. But I think I don't think AI is going to allow capitalists to exit the need for a labor force. Automation always has and probably will increasingly throw people out of work, but I think there will still be like important sectors that you need to unionize. And then as far as people that are thrown out of jobs, then you need to organize them for like similarly around like people did around the New Deal, Great Depression era, which is like the government should be providing work for people.
I think you're going to see like my guess is the first round of AI displacement, and maybe the largest one, is going to be with like white collar workers and
young professionals,
yeah, older professionals,
the people that do the work at banks and stuff.
People, with making $75,000 to $150,000 a year of those type of jobs are going to end up being replaced or just replaced by AI. And I don't know, it's going to be interesting. I mean, I don't know. A lot of those people are not unionized, and a lot of those people don't necessarily have an experience with unionization. And I don't know. I imagine we're going to see organizations come out of that, and it may, I mean, on some level, I suspect part of why you are seeing sort of like a heightened involvement and drift leftward, not necessarily to the left, but leftward of college educated people, is because of the smell of that displacement already existing.
It's sort of been happening since at least 2008.
Yes, and I think as it increases, the organizing ends up going, I think, into the sort of more like overtly partisan electoral politics, because there isn't necessarily a tradition or an experience of organizing in the context of a union. And I don't know that there are unions necessarily that that are servicing those people. And so I think that's what's going on. And I think we're going to see more of that. And we'll see how that works out.
Yeah, that makes sense. Yeah, I know that unionization rates are really low. I think it's like 10% or something like that. And at our highest, it was like a third of the workforce.
Oh, yeah. No, our private unionization rates are even lower. And our unionization rates in the public sector have gone down in part because of Supreme Court rulings. And I think we needed another 4 years of a Biden type of labor administration or more to start to see those union rates go up. I think we would have seen them. I think we would have seen unionization rates gone up had there been we had the same National Labor Relations Board as we did just a year and a half ago. Appreciate the call.
And I would just say,
thank you.
Thanks, caller. There's a old I think New Deal era poster here. If you're unemployed, it's not because there isn't any work. Just look around: a housing shortage, crime, pollution. We need better schools and parks. Whatever our needs, they all require work. As long as we have unsatisfied needs, AI is not going to solve any of those things.
Right.
We have all those needs. AI isn't going to produce any of this stuff. It's not going to make houses for you. There is all sorts of work, whether it's environmental, all this stuff. It needs to be done. We just don't have anybody who's commissioning it because there's no profit in it.
Yeah.
There's work to be done, just not the jobs.
Right.
Yep.
When you mentioned 2008, I mean, like, I wonder if there's been work on like the intern economy and stuff like that, when people were doing that was the explosion of like, we want to get a job, you better work for free for a while. And that meant that only wealthy people or kids of wealthy people were able to do that. And now those kids, even though, might be affected by this AI thing, where entry-level positions of like data entry or even actuarial work could just be replaced by AI. And so maybe Chuck Schumer is right. We should have been targeting the suburbs. Joking.
That ends the call-in portion of our program. Molly, Gray Jedi.
Anti-sound.
Sam, remember when the ICC brought charges against Israel for their genocide in Gaza, and there was an anonymous politician that said the ICC for Africa and Russia? I always knew it was Lindsay, but him actually saying it publicly was not on my 2026 bingo card.
Well, yeah, there's a bunch of people that said that just explicitly.
Yes, explicitly.
Although I will say that we're retiring the phrase "on my bingo card" in 2026, so no more of that.
That was on your bingo card.
Would never.
Biden, my time. Our action in Venezuela and the talk about Greenland reminds me of our technocracy idea that circulated a while back. Basically, the concept is that in the face of America's loss of world control, that we take direct control of necessary resources in our hemisphere, basically a blueprint for old-style empire. Yes, I think, those ideas have been going around, but here's the problem, is that the dynamic between our military might and the military might of countries that we perceived as underdeveloped at that time, it's not the same. It's just not, it's not the same. It probably hasn't been the same for 30 or 40 years, but I think sort of like following Vietnam, I think we started to realize we got to think better of this. And to go back into it, this notion that we can go down and sort of like create banana republics and have like hegemony over these countries, I think is, I think it's a silly notion. I don't think the world works that way anymore.
Yeah, I think it's just a criminal display of impotence, really, is what we've seen over the last week.
I suspect it was much easier in the, early 1900s to send a force of 3,000 Marines, because nobody knows. You see one, newspaper article about it, You send 3,000 Marines, and that is an overwhelming force to, a country like, I don't know, pick it, Honduras or whatever it is.
Algiers.
And that's that's all it takes. But we're not going to send 150,000 troops into Venezuela and commit them to 15 years and then walk out of there and be exactly where we are, 15 years later. It's not going to work that way anymore. That's the thing that's so mystifying about this is like they didn't. Sometimes I think just stupidity can actually be the answer. It's just so hard for us to grasp. Like, how can this guy be the president and be this dumb? I think that concept is just hard to grasp sometimes. Yeah. And it's scary because on some level, he could F us all. Maybe.
It gets way easier to understand as the charisma just erodes from.
Yes, that's true. That's true. Glass-Steagall. It's crazy that just coronated Delcy Rodriguez without having a primary. They could have done it quickly. It would have been a mess. All right. 5 more. JR in Philly. Sam, that's exactly what I've been saying. It's actually possible that this is a worse plan than Bush had for Iraq. Illuminati kids. I've heard a lot of U.S. Vietnam veterans were traumatized by how loud the bullhorns that they yelled apologies to the Viet Cong through were. As millennial programming was sold as a good job, the whole learn to code meme, but AI is further wrecking that concept. Yes.
Yep, that just turned out to be the thing that the tech capitalists wanted you to do so they could drive down their costs.
Bunny Planet, didn't Trump threaten Maduro's remaining people still in power the other day after Maduro was kidnapped? That's Miller's plan, I would think. Threaten the remaining leader with the same treatment as Maduro if she doesn't cooperate with the pillaging of resources.
That's what Jose Luis said yesterday, that they want to have a figurative gun to her, or almost literal gun to her head to get her to do what they want. That's they feel that's the easiest path forward because replacing the entire government, as we've said, also the military is going to have a say in this, is very, very difficult to achieve.
It'd be a disaster.
But the problem that they have with that gun is they know if they're trying to leverage her to do what they say, because it would be too hard to install a new government, she knows that too.
Yep.
That's her leverage suddenly.
Yep.
That's why it's really, I think, sort of hard to.
It was the thing they could do.
I honestly think what they're going to do is just pretend nothing happened. And in a week from now, just be like, we'll just take back one ship at a time. And
CIA is going to be super active there, I would guess.
But with what end game?
The end game of slowly turning these guerrilla groups probably on the administration and working with them to. They're obsessed with the fact that the Colombian leftist guerrilla groups have ties with the Venezuelan ones, and also they have ties with Cuba. That's their whole.
But what would be what's the end game? What do you want to have happen in Venezuela? But
they don't have they can't though.
That's
that's the thing is they're impotent.
But they're psychotic. I mean, there's.
But they're recognizing that they don't have the power to say force Machado in. So they'll probably do covert stuff, but ultimately I think this is the least that they could do while having amassed the ships in the area, and this instead of just retreating out of it, which was they could never do once they have the ships there.
I think now, honestly, I really do think in 6 weeks we're going to hear 2 ships left, and then 6 weeks later 2 more ships left.
Trump didn't want he didn't want to be humiliated. That's what probably Miller spitting and hyperbolic all the time probably sold to him on. You did this massive troop buildup, you tried to escalate a conflict with a pretext, just go in and do it. So it could end here, but I don't think the severity. I mean, I just think our covert operations are still going to be quite destructive. Is all I'm saying.
Yeah, I guess. I just don't know to what end. I just who are they going to install? That's going to be different. What is that? What do they think they're going to get?
I think honestly, what they're going to do is try to build up a new opposition.
Yeah.
But
that's going to take a
didn't
long
go,
time.
That didn't go well the first
They've
time.
been doing this for 20 years.
A quarter century.
Chapter 35 of this.
Okay, is Guaido still around?
Like, exactly. Where's Guaido right now? He's like working for he's probably working for McKinsey or something.
Yeah.
Tony32 UK. On putting you in frame, you're doing what they do in Japan, having the newsreaders in the corner to help anchor the audience. They have a similar OTT look to you.
That's what we're going for.
With the Cuomo thing. Yeah.
It's not Sam Seder. Cuomo. That's why the troops deserve a raise, I guess would have been the way to tie those two together. Just
Have you
spitballing.
seen the movie Black Sheep? Emma, you're the one.
No, I don't like no.
With David Spade and
Chris Farley. There's a point where he's high and he goes, "That's one large step for man. I have a dream." That's the Chris Cuomo model.
That's great.
Bingo Dango. Check out the new White House January 6th Truth webpage. Oh, God.
I'm good.
Left is big pharma plug. In lieu of my call being picked, please allow me to share 2 points. The fundamental issue has always been the lack of sufficient education about communicable diseases and basic science in K through 12. That was an intentional choice. In the past, the general and uninformed public at least had more trust in the government to still take vaccines when they were made available. But without basic education, with an erosion of trust in government, we stand to lose everyone to their own ignorance, skepticism, and chatty-ass grifter. I say this as a pharmacist or work in drug development and regulatory policy myself. What's further terrifying is the woman who helped Vinay Prasad, director of FDA's CBER, which reviews vaccines for safety, efficacy, and regulatory approval, undo these vaccine standards using false data. Dr. Tracy Beth Hogue is now the acting director of CDER, the part of the FDA that reviews all other drugs and biologics that everyone takes. Horrible future awaits. Yes, she's the one who authored the other dude, I can't remember his name now off the top of my head, the 34-page advice to pull back on vaccines.
Vinay Prasad, a recurring guest on the Bad Faith podcast.
All right, and 2 more. Emma's distant cousin, veteran here. You can't really support the troops if you support sending them there somewhere to fight on some BS. And the final I am of the day. Spaghetti brains. Can you believe how expensive everything is? We have the best war tacticians. China can't have our stuff. It's ours. It's expensive. The troops. Matt, Brian, Emma, great job today. Folks, see you tomorrow.
It might take all the strength I got to get to where I want, but I know somehow I'm gonna get there. I wasn't looking when I just got caught between the truth and the lie bar. But finding out won't make me feel any better. Yeah, I know the clock is ticking, but the meds are gonna kick in, and my pilot lights shining bright. I get somewhere the choice was made for the option where you don't get paid.